Everybody drinks. Everybody goes to pubs, and you don't tell them that, do you?
I do. I tell everybody.
I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully.
There, that's where your penis is. That's where you breathe from, and that's where Dr. is showing you.
Exactly.
Oh, dear.
This is just this morning.
I've got liver cancer, not brain cancer, you know, but can still function, and I want to do that. Every day's precious.
Good morning, Putney Lead Iris speaking.
Yeah. I'm just trying to see who else does it.
And your name?
Who else does that thing for you? I'm trying to see which other doctor does it.
Hello. Sorry, I've kept you waiting too long.
It's all right.
How are things?
It's peculiar what happened. I was stung on my arm by a wasp that came in through the window.
OK. So when was this?
It was a couple of days ago. I couldn't move my arm. It swelled up, and then it felt achy all the time. It's still funny, my arm. I don't know whether it's because I'm a funny woman.
Do you want to show me where the wasp stung you? Do you want a hand? There we go. You got that one?
It sort of swelled up there, and it still prickles or something and aches.
Well, nothing's hot or red or angry.
It aches still.
Now, what's happening with the psoriasis? Have you been going to see the dermatology nurses?
I haven't, because I've been too busy.
Because they were supposed to see you, weren't they, in the daycare so that they could do your creams for you. It's still quite bad on your elbows, isn't it?
It will go. It doesn't hurt.
What's stopping you from going to see the nurses?
It's because I'm tired. I get tired. I can't sleep at night. I lie awake. We're moving.
Yeah.
And it's awful.
What's happening with your sister?
She's going to the country.
OK.
Retirement home.
And have you found anywhere that you're going to live?
No, I can't find anywhere.
As GPs, we're always taught that we should ask open questions and let patients tell their story, but it can be really difficult when patients bombard you with lots of different pieces of information at once. In a 10-minute consultation, that's really difficult.
So are you wanting to buy something then?
I want to buy a flat for the rest of my life. I'll be on my own with my cat, that's all. My sister doesn't want me anymore.
Oh. So did you ever think about going with her, or do you want to stay in Putney?
I want to be near Morley College, where I give concerts and I play Beethoven, Chopin, Brahms, Rachmaninoff. And I played all my life since I was 5 years old.
OK.
Music keeps you young. It kept me young. My father died of a heart attack in the hospital. I just visited him, and he said, good luck for your concert. And it was sad, really.
No, it is.
He said, be happy when you play. And he smiled. That's all.
I'm falling apart, basically.
Right. Oh dear, okay.
The last 4 or 5 days, I think I had an ear infection. My ear was agony.
Right.
And also, I would like you to look up to see what progress they're making towards this hernia.
Right.
And the large cyst I found, and I've had enough.
Yeah.
Do you mind if I have a good look at all the joints on each side?
No, have a look at everything.
Pain when I'm pushing?
Yeah.
Up and down, does that cause pain? Okay.
Yeah.
Bet they fractured the bone in my groin
When?
when they done the angiogram.
Okay. All right. Where do we start?
You have to go in soon.
What?
You know, the doctor's going to look at your ear.
Okay.
Are you going to be a good boy and let him look?
Okay.
Are you going to be a good boy?
Yeah.
Hello.
Hello.
Yeah.
How are you?
I'm well, thank you.
Hey, Mommy.
Hello, Matthew.
Hi.
When did I see you last? That was a while ago.
Hey.
It was
It is a
quite
while
like
ago.
10, more like 10.
Yeah, 12 now already. He has got another ear infection, and I only noticed it yesterday evening when we were in church that he had a lot of gunk coming out of his ear. He won't let me touch it.
Right.
He insists that it doesn't hurt, but he quite often does that. I've never been able to be sure whether he's just got a very high pain threshold or whether his communication's a bit off around it.
Cough, cold, snuffly nose.
He's been very tired, but no, not really.
No.
And
Fever?
it's quite difficult with Matthew because he doesn't tend to develop particularly high temperatures.
No.
And quite often, you know, it's only when you see the evidence of something. I imagine this has probably been quite uncomfortable for him for some time, but it's only seems to be when there's some visible sign.
Let's have a little look at your ear.
Yeah.
It's a bit of a mess, isn't it? You can't see it, though, can you?
He won't let me clean it or anything.
Can I just touch it with a stick?
Hi.
Yeah, not going to go inside, just on the outside. Get a little bit of that fluid. You look at Mummy for me.
Matthew, look at me.
That's good boy.
Look at me.
Ow, ow, ow.
Good boy, good boy, good boy, good boy, good boy, good boy. Ah, good boy.
Well done. Good boy, Matthew.
I like your jacket, Teresa.
Oh, do you? Well, you're not having it. I'm joking. I've seen you for a while.
No, we haven't. Have you been well this evening?
Yeah, but did you go to get fun
So
one
yesterday, I read this. It really frightened me when I read it.
Oh, really? OK, well, we can talk about that. With this, what scared you about it?
It scared you about people dying, you know, not surviving the operation and that.
Yeah. OK. Did you understand what it's talking about, this?
Yeah.
Aortic aneurysm? Yeah. What did you understand by it?
Well, because my father had one.
Did he? You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot. Do you know if I've got one?
Hi. Oh my goodness. You have got a really big buggy, haven't you? Yeah.
Does the airway sound quite tight? Oh dear. Life is hard, isn't it?
All right, okay, all right, dude. Okay, cool. Oh.
Can I just pop this in your ear and take your temperature?
Did you hold your hand quickly?
Just, whoopsie.
Oh dear.
It's all right.
Poor old you.
Come on, Bubba, please.
You got your hands full, haven't you?
Absolutely.
Do you want to just give him a cuddle and then I'll just have a look at it?
Oh, come on, Bubba. Come on, sweetie.
Hi, how can I help today?
So we just need to get a certificate of health from his modelling agency.
Let's have a look. She's going to be a superstar, is he? It's nice to see a well baby. I see lots of time seeing grizzly babies. Now, we'll have to ask at the desk whether or not sometimes these things don't technically come under NHS services and sometimes there's a fee.
Oh, yeah. No,
but I'll ask. Can I have a look at your tummy? Lovely, we'll just give you a little once over. Oh, let's have a little listen to your heart. Good boy. Look in your mouth. Good boy, thank you.
Very good.
Magic. Magic. So what I'll do is, I've got no reason to be concerned at all. I will sign this and I will just put it in an envelope and ask you to speak to Nicola, who's currently on reception.
Okay.
Good luck with his stellar career.
Thank you.
Are you still smoking?
I still smoke consulate, cool as a mountain stream.
How many a day?
About 10.
Okay. Any thoughts about quitting?
What?
Do you want to stop?
Watch what?
Do you want to stop smoking?
Not particularly at the moment, I'm worried.
I mean, it may not be the right time for you to stop smoking now, but I think it would be important to do it when things are more settled. What about alcohol? Because alcohol can increase your risk of osteoporosis.
I'm trying to cut down.
That would be really important if you try and cut it down so that you're having less than 14
My sister, we
units.
both try and have half a bottle each.
Over what period of time?
On a night.
Half a bottle a night?
We have little small glasses. We fill, and she goes back again and fills.
But if you're having half a bottle every night, that's much more than...
No, she has her bottle. I have mine. They are small ones.
OK, but even if you're having... What, do you have the whole bottle?
No, we don't drink... No, we have she has a small glass and she fills it about that full.
Right.
Full.
What we recommend is that you don't have more than a bottle, if you're drinking wine, a bottle and a half a week.
Oh, everybody drinks. Everybody goes to pubs and you don't tell them that, do you?
I do. I tell everybody that they need to not drink more than the recommended amount. The other thing that you need to do is make sure that you're getting enough vitamin D and calcium in your diet.
Oh, I expect you're hungry, aren't you? Have you had your lunch?
I haven't, no. I've been busy.
Oh. Well, you must come to my flat when I buy a modern flat in Putney and have a meal. I'll cook for you.
Thank you.
Spicy cheese grilled.
Okay.
And you put tomato puree, a bit of that, and you make an ordinary tasty thing, and you put few herbs in it, and then you grill it, the top of it.
Sounds good.
And put a gherkin on top.
OK. Right. The things that I'm going to do is, why don't we see each other in a few weeks, OK?
Good.
And then you go and see the dermatologist tomorrow about the skin, OK?
Yeah. I better go.
All right.
Thank you very much.
And that's your time of the appointment, remember? So you take that. All right, so you go and see them tomorrow.
Thank you.
See you later.
What do doctors do when they, finish at 12 but then start again at 5?
They either go home if they live close, or they do paperwork, catch-up work.
This is Dr. Hassas from Putney Mead Surgery. Hi there, I had a message to give you a call, sir.
The work is endless. I was expecting to see you this morning, I think, to check your blood pressure. When we've finished seeing our patients, we've then got to type our own referrals, read all the letters coming back from the hospital. We need to check blood results, review people's repeat medications. The list is just goes on and on and on, and you never feel like you get to the end of your work.
Well, when did all the trouble start?
I tried to ring you yesterday, but you were unwell.
Just give me an idea how long this has been going on for.
Right.
Give me a rough idea.
OK, take care. Bye.
Yes.
So they haven't written to you because you've got one. They've written to you and thousands of other men of your age to see if you've got one. Did you understand what it's talking about, this aortic aneurysm?
No.
No. What we'll do, why don't we draw a picture? So, my drawing's very bad, all right? And that's your body. OK. It's not a very good drawing. But your heart is here.
I think that's your legs, Richard.
Brilliant. Well done.
And
Yeah.
there, that's where your penis is. That's where you breathe from, and that's where Dr. Owen's showing you.
Exactly, exactly. So, this bit here is called the aorta. And normally it's nice and straight like that, like a railway track. Sometimes it can swell up a bit like an orange, and it bulges out. And this is what is called an aortic aneurysm. What they've done is they've written to you to get you to have a scan that just looks at your aorta in your tummy. So it's not saying that you've got an aneurysm. It's not saying that you need an operation for it. You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot on the heart.
Okay.
Yeah.
He had an operation on an aneurysm, did he? Did he? Okay. But just because he...
But he had a blood clot there.
Did he? Yeah.
So...
Yeah. After operation, sometimes people can get blood clots, unfortunately. But just because he had it, it doesn't mean you've got it. Richland trees, they have different needs from a lot of our population. From my point of view, I see my role as helping them negotiate the health service in order to use it effectively. Richard, they're not going to do any operations on you. What they're talking about doing is putting some jelly on and having a look. You know when pregnant women have their babies looked at?
I'll be with you.
Oh, is it the same thing?
It is, yeah.
Oh, right.
It's what's called an ultrasound scan. Okay.
It's
Pressure
got
off
nothing
that
to do with
area.
his stomach, is it?
No, it's nothing to do with your tummy being big. Okay. Sometimes, if you're very thin, we can feel them, but I think you're a bit too big for us to feel it. I can try and feel it if you like, but it's quite hard to. If you've got a bit of fat on your tummy, we often can't feel it.
Doctor, don't say that. He's trying to lose a lot of weight, is he not, son?
I'm not overweight.
Yeah.
No, he says, look, he's laughing.
I'm not laughing. But you know your tummy's bigger than mine, isn't it?
Yeah, but it's not that...
He does go to the gym a lot.
That's really good. And going to the gym helps stop things like this. Yeah, that's really helpful.
Can we give you some medicine?
Yeah.
You sure?
Yeah.
Okay, good. So, ear drops, have you had much success with over the years?
No.
No, okay.
Getting anywhere near his ears
Yeah.
is...
So I think, you know, the swab should just give us the bug and hopefully which antibiotics it might be sensitive to.
Mummy.
Aren't you?
Mummy.
You let the doctor look, didn't
Mummy.
you? Yes, Matthew.
Down.
Down?
No, down.
Dance?
Yeah.
Are you a good dancer?
He's
Are you?
addicted to Strictly Come Dancing at the moment.
Oh, I'm addicted to Strictly Come Dancing. Who's your favourite?
Football.
Football?
Football?
Yeah.
So who's your team, Matthew?
Fulham.
Fulham?
Yeah.
Excellent.
Fulham.
Fireworks. Kitty and fireworks.
Yeah.
Your favourites?
Yeah.
Fireworks night's coming up.
Yeah.
We went to see some fireworks last night, didn't we, Matthew?
We're going to watch some fireworks tonight.
No, I'm going to watch the FA Cup.
Oh, sorry. Got the wrong pastime.
Well, yeah, fireworks are for kids, aren't they?
Yeah.
Did you do anything for like fireworks last night?
No, I was too tired. And it was too cold.
Yeah, that's true actually.
I haven't been to a firework display.
You wouldn't believe what my brother's dog did. They were out. This is last year. A hole through the door. I'm not joking. It's terrible.
When did you get her?
She's 3 months now.
Really? And she's a hearing dog, is she?
Yeah.
No?
Yeah.
No.
She's an everything dog.
An everything dog.
Diabetic dog.
Okay.
So she knows just that.
Really?
The cover.
Yeah.
Very clever.
Brilliant.
Almost as clever as you. Have you got a dog?
No.
I
don't want one. Okay. What pain? Really? Tell me about it.
Because I'm walking her all the time. It makes me twat. And I'm walking her.
Are you getting it every time you walk her? Yeah. Will you take off your shoes and I'll have a look at your feet and your legs? Okay. Let's have a look. And is there any pain when I'm feeling your legs? Does that hurt?
That.
Yeah. Okay. I can feel some veins there, but what we always wonder about is that we know your diabetes isn't very well controlled.
I'm on the wrong insulin. This is why I'm waiting for the referral to go and see the
And I'll ask about that. That's fine.
I sat in an empty waiting room for over an hour. Right? I couldn't get out of the chair. I can't sit down for very long. Right? I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully. And when I said to him, why am I an hour late? And I did do that. Why am I an hour late? And we take a longer time because we care. I don't give a toss who you care about. Do you know what I mean?
Yeah. It can't be that people are upset by every interaction you have with our surgery. That's not fair.
Could you have a look at a mole I've got that's behaving a bit funny?
I've got burns.
Okay.
And then I have a mole here. It's just a bit scary.
Right, how long's that been there?
Over a year.
You can just feel it, can't you?
Yeah. So it's quite rough in texture, isn't it?
But anyway, you might be able to see it.
Oh, this.
Just looking at it, it doesn't look like anything sort of overly sinister.
I can reassure you that this is not a sinister type of mole.
This is a freckle. Very unlikely ever to cause you a problem.
The things that we do look for in moles, we have an ABCD rule. We look for any asymmetry of the mole, so anything that looks a little bit irregular, any change in the border of the mole. C would be for colour change, so if you're getting darker patches within the mole, then that's something to worry about. D is for diameter, anything that's more than about 6 millimetres. E for anything that's evolving, so anything that's itching, bleeding, anything that feels like it's changing, always come and get that checked out.
Yeah.
Okay. Have a good rest of the day.
Right, you too.
Take
Right,
care.
thank you.
Bye.
What were you thinking we might do about this pain?
Tramadol, actually.
Really? Just painkillers?
Yeah.
We can certainly go with painkillers, but we need to be cautious with you because you are at risk of getting problems with the blood supply to your legs. If you get any chest pain when you're walking, or if you're noticing that when you walk a certain distance you get pain in your legs that settles down when you're resting and then comes back when you start walking again, it's very important that we do get a vascular surgeon to see you, to check on the blood supply to that area.
Does it look like it's got a reduced blood supply?
No, not significantly, but actually...
Don't tell me significantly. Does it yes or no? If it was your foot, would you take it somewhere?
Part of my job is to manage risks. I know that you're at a high risk of having problems with your blood supply because of your diabetes, okay? So it's nice to want definite answers from doctors sometimes, but we can't always get them. It's not, is it?
No,
exactly.
just based on the opinion of the individual.
When you came last time...
Oh, God.
Why do you say that?
I'm very flexible. I come here for is to get my medicine.
Yeah.
I
There's
don't wanna
flexibility on
ruffle.
both sides.
Exactly.
All right? I'm very flexible with you,
No,
okay?
come on.
What I would say is Doesn't matter what profession you work in. If someone shouts at you when you're trying to do a good job, it's terribly upsetting.
Right. The reason why I knew that she was talking is that all your muscles here move when you speak, even if you don't move your lips.
I'm sorry,
am deaf.
you've obviously had
I am not stupid. I have an IQ of 156. You know, I don't want to be, and how are you today? I could just feel the hand patting my head. No, you don't talk to people.
All right, I will leave
And
that.
this, you know what I feel about that.
Yeah. Do you know, when I see you, do you know probably on average how much time I spend with you?
I know. I know.
Yeah.
I don't understand and there's some grateful for it.
These are just normal people. We're all normal people, but it just worries me the regularity of it. Abuse within the NHS is taken very seriously in every practice, but the aim isn't just to tell people off, it's to try and work out why they felt the need to react in that way. And usually you can work with people and find a way forward with them.
It was because I was so stressed. I will apologise to him.
Did you?
No, I will.
Okay.
But I will apologise. And
Let's,
as I
we'll
say,
finish now, all right. I'll get that one. I'll find out what's happening about that diabetes appointment. Come back and see me in a month.
Month.
Yeah. And we'll see how your legs are doing. Right.
I am sorry.
Do doctors get ill? Like,
yeah.
Like, how? They're doctors. Can they just... It must be so weird being a doctor going to the doctor. I think I've had this conversation with you before.
How was your holiday?
Oh, it was lovely, thank you. Very nice. We went to Snowdonia and did some walking. Came back and got a bit ill again, unfortunately.
A doctor got ill?
Oh, yes, quite a bit.
Oh, that's no good. Are you better now?
A little bit, a little bit. I'm usually very well. Last time I was ill was the swine flu, so...
Don't go on holidays. It sounds fatal.
Hi, come on in. Right, so you're here for a refit of your implant.
Yeah.
Perfect. So, is this the first one that you've had in? Yeah, and you've been really happy with it as a method?
Absolutely amazing.
Great.
Couldn't ask for better. Yeah,
Brilliant.
really good.
And have you had any side effects from it?
Not at all. Well, the first couple of months, I think I was told it has to regulate out.
And then you've just had no periods for the last 40 years.
Perfect. And I suffered really badly with cramps and everything beforehand, and it's just completely eradicated the whole thing. I haven't had anything, so it's been great.
Fine. So it won't be painful at all. Taking it out can be a little bit fiddly.
Okay.
Because after 3 years, the body can put some fibrous tissue around it as a little sheath.
Yeah.
Are you happy to get on with it?
Absolutely.
Is it left or right arm?
I'm in here.
You've got it in your right arm. Okay. Hopefully that will be straightforward to get out. So what we need to do, I pop you on here. So I'm just going to get everything ready on the trolley. The first thing I'm going to do is just do the local anaesthetic injection. Well done. And once this starts working, you won't feel anything else, I promise you. You will be able to feel me touching you,
but not pain.
But you won't be able to feel pain. Okay. So, can you feel anything? Wow. I'm just releasing the little capsule that I talked about that can form around it.
Okay.
It's out.
Brilliant.
That's pretty quick.
Oh my goodness.
And I can put the next one in.
Okay.
And you will be done. Just put it on a little pathway just along the side of the original one.
Okay.
Done. Wow. Finished. That was really straightforward. You did really well. And this will last you another 3 years until you come and have your next one in.
Come in. Hi there. Mr. Gomez. Hello, sir. Come on in.
You don't know about me, do you?
No, it's the first time we've met, so no, I don't.
I've been a patient here for a long time. And I've discovered that I had cancer, liver cancer, a couple of months ago, but it's very bad. It's beyond surgery, so I'm going in towards, I think, the end of this month for the chemo. It's going to be a chemo Christmas.
Right.
I live alone, and I'm really struggling with the pain of this. It's extremely painful. It's those I'm taking. They're supposed to be every 4 hours, but I can take them every 1 hour, up to 1 hour if I want them. So I'm taking them every 1 to 2 hours.
Okay.
Sometimes I take them 3 and on the trot, 1 hour on the trot. And then something, but I try not to, because I don't want to build up too much tolerance, because when I get to the end of all this, I'm going to, I'm going to end up taking buckets of it, and I don't want to do that. I've been in so much pain for the last couple of months.
And where is your pain at the moment?
Oh, it's all in this region
on the
here.
side of the liver. Okay.
Yeah, it's all in that region just there.
Okay.
I can't do anything like cooking, getting up, and the other thing is, look, my legs. This is all like water. She said it's water.
It does look like watertight, isn't it?
My feet are like loaves of bread. I can barely get my shoes on.
And sometimes when you have problems with your liver, the amount of protein in the blood drops, and then the fluid is just leaking out into the cells, and that's where you get the swelling.
Yeah.
So the idea, I think, probably behind the chemotherapy and all of those things is to reverse some of those side effects of the liver problems.
I hope so. It's, I don't know. I don't know. See, I'm on my own. I'm taking care of myself.
Right.
So it's very difficult,
Yeah. Have you got any other support around?
At the moment, that kind of support, I don't want that support,
What kind of support?
Like coming around and cooking for me, cleaning for me, doing
Right.
I want to do that myself until I can't do it again. I've got liver cancer, not brain cancer. It's I can still function, and I want to do that. Every day's precious. I don't want to give it up. I don't want to give up responsibility. I want to go down to the shop and get a loaf of bread.
Yeah.
I want to touch it before I buy it. Is it fresh? You know what I mean? And I want to do these things still, and I don't want to take that away from me yet.
No.
That's all I've got really. The little things in life, which are the valuable things in life.
Precious.
Just take the dog for a walk on Wimbledon Common with the boy. There's lovely little precious things. But you can't do it if you're in agony.
How long were you in hospital for?
2 weeks.
2 weeks,
yeah. They took me in. They said, your bowel's ruptured. Basically, I've been walking around with a ruptured bowel for God knows how long.
And how are you managing now that you are home?
I'm okay. My belly's a bit of a mess.
Okay.
And I've got a bit of a hole here.
Okay.
I'm just worried about, because I wasn't told anything about Crohn's disease. I don't know what to eat, what not to eat.
When you've had part of your bowel removed, your bowel absorbs nutrients, and so depending on what part of your bowel has gone, you need to make sure that you're getting all the nutrition.
Hungry all the time. Is that normal?
It can be. It's a big thing for your body to go through, and your body will be working harder, helping to heal everything up, and your calorie demands will be higher. And how are you doing? A lot of people struggle at the beginning with just how it all feels and looks like. How are you?
I haven't got a colostomy.
Have you not?
No.
Oh, I thought you had a colostomy.
No, I just missed it.
Oh, I didn't know that.
Just missed it.
Wow, so they resected your bowel and then...
I'm really lucky, because I think I'd just die if I had to have one.
I thought you had a colostomy.
No,
okay.
That's why I'm worried about what I eat, because that surgery could happen again, and I don't want one.
No. You're doing an amazing job.
Thank you.
So far.
I don't have very long, and I don't know. I'm going through all kinds of negativities,
About the chemotherapy.
Yeah, once I'm in there, I'm wired up. That's it. They got me.
Part of my job as a GP, we deal with people who have terminal diagnoses, and it's always upsetting to be with someone who is going through those stages of life. You have to try and keep that emotion to yourself, and make this the interaction about them.
What are you worried about? What worries you about? The agony of
it. I know
the pain there.
I know what's coming. Yeah, I already know what's coming. I can feel it. but with the chemo, I can possibly push me up to a year, maybe beyond.
I'm always impressed by how people find resources within them to face the final days or weeks bravely.
I've got a severely disabled lad. He's blind. You know, I've been his sole carer for the last 16 years.
Right.
It's my son, yeah. And I need to prepare him because he's acquired brain damage. You know, he needs to be prepared for this one. You know, we protected him when his mum had cancer, and she died, and he was in a mess. You know, so now he's going to have no one there.
Does he have any carers or any?
Oh yeah.
He's got people around him.
Yeah,
okay.
he's with guide dogs. You know, he's got a guide. So
there's all that worrying you.
Yeah.
As well,
His welfare. Yeah, his mental state. That's what worries me. Yeah.
And what kind of support, ideally, do you think he would benefit from?
Well, that's what I mean. I want about a year to sort of watch it. You know, to sort of, I need a year to get him prepared and to be prepared to be on his own now.
Yeah.
You know, there's things I need to settle and take care of. Yeah.
If you have a think, and if there's anything else you think you need help with, or we might be able to help with, will you just give us a shout, and we can work it out?
Yeah.
I'll give you the amounts, more of these both.
Oh, the same again. Yeah.
Yeah. I'll give you a bigger volume.
Yeah.
So that he doesn't run out.
Because I need to get this under control.
Yeah.
The management, the pain management. Yeah.
The pain we will get under control. The pain will get sorted. All right. Nice to see you. Give me a shout if there's anything else.
Thank you very
All right.
much. Thank you.
Take care now. Cheers. Bye bye.
Come in. Hello. How are you?
Okay.
You're wearing glasses. Oh dear.
This is just this morning. Sunday was kind of okay. It was a bit swollen underneath, and then this morning, swollen even more than this.
So it's got better throughout the day?
Yeah, a little bit. I did take an antihistamine in the morning.
And do you think the antihistamine's made much of a difference?
Not really.
And then, is it very itchy?
It's not at the moment.
It's just very puffy and swollen, isn't it?
Yeah.
And you're not wearing any eye makeup or anything like that?
No.
Poor you.
I'm also concerned that, the flaky skin bit kind of seems a bit yellowy.
One of our doctors does have a special interest in skin. Let me see if my colleague's available, just to get a second opinion.
Is it just on your face?
The swelling is, yeah.
If we give you 2, so we give you the 1% hydrocortisone.
Yeah.
Use the stronger one for a couple of days.
Okay.
Just to get it down and get some of the swelling down.
Yeah.
You're going to have to moisturise well, because as soon as that swelling has gone down, you're going to go wrinkly.
Yeah, yeah.
Which is horrid. What job do you do?
I'm a teacher. I've got parents' evening tomorrow.
Oh dear.
Do you feel sort of anxious or worried?
I'm not sleeping very well at the moment. Which is very unusual for me. I wake up all the time.
I'm still not sleeping properly. I haven't gone back to work yet because I've got another certificate from another doctor.
Okay.
And I prefer to have another couple of weeks off so I can get my head together and think what I've got to do.
And the problem with sleeping, I don't get sleep at all. Maybe because of the stress, the workload, what I do could be the reason. And tiredness is for the last 2-3 months. I'm really, really tired.
I mean, this kind of gives a good description in some ways of what you've been experiencing. You're finding it hard to kind of see the light side of life and not enjoying things as much as you used to.
That's been quite a stressful few months.
It has been a stressful few months. I can't get through the day. I'm kind of worried.
But small steps, because you've come a long way.
Hiya. Come through, Tony. How are you? Well, thank you.
You look great. Like the trousers.
Thank you.
They're fab.
Back at uni, so...
Oh, right, OK. What course are you doing again?
English literature.
Right, yeah.
I got a letter from Dr.
Ducci, yeah.
Yes. And you're on a waiting list for psychotherapy?
Yes, I'm currently seeing Dr. Healy at the Wandsworth Complex Needs every 3 or 4 weeks.
Right.
When I first found out I was diabetic, it definitely really threw my mental health, and I think I definitely wasn't coping for a period of 6 months, and I think I've got over that phase of, I think it's called burnout, when you stop testing and you stop really trying to look after it, and I think I'm testing 3-4 times a day now. I'm really trying to get a control of my blood sugar.
Yeah. Whenever a young person, particularly that has had a mental health problem, gets a diagnosis of type 1 diabetes, it's a very difficult combination. I haven't seen you when you're unwell with your mental health. And Dr. Ducci's indicated that you've had some really difficult times in the past.
I lost my mum when I was young, and I was initially born in South Africa, and now I'm at 15 social services intervened, so I've pretty much looked after myself since I was 15. So that's probably a lot of the issues. It was very early independence.
And were you very vulnerable at that time?
I think so. I think asking any 15, 16-year-old to look after themselves is a big thing, but I wouldn't have changed it because I'm here where I am now. And
brilliant.
Yeah.
I know from my experience of being a patient how much courage it takes to come and sit in the chair of a patient. It would have been about 15 years ago. I had an eating disorder throughout medical school, and it happened at a time when I was a single-handed GP running a practice on my own. I had 3 children under 5, and I was working very long hours with very little sleep. It was very difficult to sit in that doctor's chair day after day, year after year, telling people to look after themselves when I was crying out to be looked after myself.
I think you're very self-aware, and you're obviously resourceful, built self-reliance, but just let people in as well.
I went downhill pretty quickly until one day I could only get halfway to work and decided I couldn't do it anymore. And that's when we called our own GP and asked for help.
Is that everything?
Yeah, I think it is with me.
Yeah. Have a good day.
Thank you very much. Thank you. Bye, Tony.
I've come through. I'm able to truly accept that illness is not your fault. And doctors are patients too sometimes.
I squeal in the night because it's like someone's sticking a probe in my leg. It's absolutely bizarre, and I've had it for months.
So you must be very pleased you're pregnant and also
No, I'm
quite worried.
absolutely terrified.
Are you terrified?
Absolutely terrified.
Sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
You know, just thoughts about ending it all and how I do it.
I know it's a nuisance when you're there, but it's just delayed things for you anyway, hasn't it?
Thing is, I'm absolutely furious. Wait. That was even bigger.
Seriously?
Have a look.
Oh my goodness! Oh my god!
morning, Alicia speaking. How can I help? Hi, Jackie. Hi, come on in. How are you?
I'm good, thanks. And you?
Good, fine. I've got Dr. Dillon with me, who's just started with us. So she's just watching at the moment. Right. How are things?
Fine. Well, it's really daft, but I got a bee sting on Saturday, and it didn't hurt really at the time, but yesterday and today it's swollen up and it's so sore. So I just went to the pharmacy just to see what can I put on. I've been putting Antisan on it.
Okay.
And I've taken Piriton, but it's just so sore and itchy. But he said, oh, I think it might be infected because it's a bit hot and throbbing. So he said, oh, just see.
So this happened on Saturday?
Saturday.
Yeah. Okay. And I'm just going to squeeze your nails, so it's going to be a bit sore for you. I'm not actually convinced that it's infected.
Oh, good.
It's really difficult with fingers because if you'd kind of got bitten here, it would just swell and it'd be able to swell a lot. Whereas with fingers, for some reason, they can only just swell a tiny bit.
Right.
And if they get to a point and they just get too tight and it gets really sore and throbbing, which is what you're
this is what it's like, but I'm sure that's fine then, do you think?
It is fine. So antihistamine is the right thing to do.
Okay.
The other thing that would be really good is if you can elevate it. So tie your arm up so it's around your shoulder. That would just help gravity to kind of get rid of some of the swelling, and hopefully it would get better. But I don't think it's infected. They're a pain, aren't they?
I know. I mean, I have been stung before, but I can't really remember it. But honestly, even at night, I've been waking up because I've been going on it, and it's so hot and sore. Right. That it?
That's all.
Don't need to do anything. Lovely.
No, fine.
Okay.
Keep doing what you're doing. Yeah.
Lovely. Thanks a lot.
Bye.
Bye.
Oh, and then guess what? When I went home yesterday, I'm like, what's that moving? Them proper ones with a big long leg spider, thin one, Literally, it was right where I had walked into. So I was like, oh my God, I just touched that. Nastiness.
Nastiness.
Hello, come through. Please have a seat. I'm so sorry to have kept you waiting so long. I apologise for that. How are you?
I'm all right.
Great.
I don't know if you remember, I had a spine fusion operation, to sort of fuse the fracture. I don't know whether this is related at all, but since that operation, I've had these weird, they're very difficult to describe, these weird pains all down through my legs.
Frances had originally come to the surgery a number of months after she'd fallen over in the snow. She had significant back pain, and an X-ray actually showed a broken bone in her back. She went on to have an operation to stop the pieces of bone from moving around, as it was thought that that was what was causing her back pain.
The minute I lay down to go to sleep, turn on my side, and then it's like electric shocks just whizzing up and down my legs, all around my knees, hips, ankles. It's really distracting, and sometimes I squeal in the night because it's like someone's sticking a probe in my leg. It's absolutely bizarre, and I've had it for months.
Had you ever had it before the operation?
No.
When did this start?
Well, it's hard to describe because it's kind of crept up. I'm just sitting like waiting for you then. You know, I had sitting like that and I get pains down here and it's weird. But going to bed, I sort of lie there and it's like, okay, it's starting. I can feel it starting. And then they whizzing around, bizarre electric shock type pains.
Electric shocks?
That's sort of what it feels like. They kind of creep up on you and then they go they whiz.
Do you have pain in your back now?
No, the bone pain went immediately as soon as they fused the bones. The muscles have taken ages to heal.
So these pains, is it mostly in your right leg or your left leg or both?
Mostly my right leg.
I might ask you to pop your trousers off if that's okay. Jump on the couch and then there's some more blue roll that you can just pop on your lap if that's okay.
Yeah.
And if you give me a shout when you're ready and I'll come through. Great, so I'm just going to check all the nerves in your legs, if that's okay. What I'd like you to do now is push up off the bed with that leg, and now that side, and pull down, and the other side. And bend your knees up for me and push me away with that leg. Push me away, pull me towards you. I'm just going to lift your leg up and rest it on my arm. I want you to go completely relaxed and floppy.
Sorry.
Good. Feel free to pop your things on, come and have a seat. Right.
It's weird, isn't it?
It is. I'm not completely sure what the problem is. What I'd like to do is do some blood tests to check some of your vitamins and sugar control and stuff like that, and then see you with the results, and we'll make a plan about what to do. Does that sound okay?
Yeah. But you don't think it's from what they've done on my back? That's what I was more concerned with, that it was...
No, I don't.
You know,
because the nerves which supply your legs come out much lower down.
yeah, okay.
Okay.
Right, thanks.
No problem.
Thanks very much.
See you again.
You're making tunes for us. My neck hurts.
What are we up to?
Apart from being very, very angry, now I went to St George's. I got there at 2 o'clock. She looked in both ears, clogged up with wax.
Right.
So she said, you have to see the doctor in order to get syringed.
Right.
3:25, I was rather miffed because I was still sitting there.
So I guess what's happened is you left without your hearing test.
I
And
left
you
the
came the other day to get your ears syringed and there was a problem there. And so your ears are still filled with wax and I'm going to need to refer you again to get them sorted out. Is that right? Is that where we're going with this story?
More or less,
Yeah,
yes.
okay,
But
fine.
the thing is, I'm absolutely furious. I've been a bit worried about my hearing in the last couple of years or so.
Yeah.
I don't catch things that people say and everybody else does.
Partner keeps telling me to get my ears checked because she thinks I'm going deaf. She also talks to me when she's not in the same room and expects me to hear her.
The one on the left, it sounds like roadworks at night.
Oh, really?
As I'm talking now, I feel as if I'm hearing out of this ear, this ear, but not this ear. But very well.
There's a little bit of gunk coming out of his right ear.
Let's have a look at the ears now. So what were you coming to tell me today, just about this story? Was there anything new?
Well, actually, I was coming here, hopefully with clean ears, in order to make another referral, because I came to the conclusion that referral you done the last time.
So I've done several referrals for this. I really understand with Ian why he was so frustrated at being kept waiting at his hospital appointment. The problem is that all the clinics and services are really overused and oversubscribed, and so inevitably there are delays in treatment. Sometimes I think people forget that. People will get the care that they need, but often it may not be as smooth as they'd hope.
But at the same time, I'm not impressed by these olive oil drips, because every time I put the cotton wool in and take it out just before going to bed, it's just the staining of the oil.
So the reason we get you to use the drops is hopefully it will encourage it to come out, but if not, it softens it, so it will make it a lot less painful for you to have that wax removed. So I know it's a bit of a nuisance having it done, but similarly, it needs to be done for us to get the wax out.
Yeah, I understand that. What I was thinking, though, is like going back to an old and tested method which worked, was getting the olive oil, not the drops, heat it, and then pour it in, and then put in the cotton wool, because the heat from the olive oil going in is going to melt it a lot quicker than cold olive oil.
But it will also damage the skin in the ear. So I wouldn't heat up oil and put it in your ear. I think that would be a disaster.
I'm not saying it's going to be boiling. It's
you'd warm it, but
just warm it.
yeah, I probably wouldn't do that, Ian. If it were my ears, I definitely wouldn't. Had you just sat there a bit longer at the clinic, you probably would have wax-free ears now. I know it's a nuisance when you're there, but it's just delayed things for you anyway.
I've got other things to do rather than sit around waiting.
I do get that, Ian, but at the same time, you're going to not have your hearing so well for the next couple of months while we get this sorted.
Nothing unusual then, is it?
Okay, right, all done.
Is it?
Yeah.
Right. I will sort that out.
Okay.
Bye.
Bye. There's nothing especially wrong, but there is something that's concerning me, and I don't know whether it's something or whether it's nothing or what. But just to give you a bit of background, my best friend was diagnosed with ovarian cancer 2 months ago.
Okay.
And I don't know whether it's just because it's very close to home and I'm seeing her and speaking to her every day, that it's making me concerned about ovarian cancer, other types of cancer, just all sorts, really. I appreciate that this is probably so stupid, but when I push in my ribs here, I feel like I'm pushing something back. Whether it feels like, I don't know if it feels like a gland or I don't think it's a lump, and I feel like it's always been there. Like it could have been there 10 years ago, but it never would have worried me, never thought anything of it. But now, because my mind is just like in overdrive, it's kind of was nothing, and now it's something, and I almost just need to come and speak to someone and just so I can.
Sounds like you did need to.
Yeah.
So let's feel your tummy and see what there is. Sorry, hands are cold. So actually, show me where you felt at the top.
Here.
Yeah.
So if I'm lying down now, I actually can't feel anything. But you know what, I just find myself there all day going.
Feeling it.
And now, and then I think, because I think that's, I feel like I can feel something constantly, and I know the minute I'm not thinking about it.
Okay, let's start with this and see. Okay, tell me if you get any pain at all. Okay, so when I did that, not painful anywhere?
No.
Okay, let's get you to stand up. Okay, and then show me where, feel it if you can.
If you put your hand there,
Yeah.
I feel like I can feel something.
Okay, yeah, I can feel that. What you mean.
And then just
you
a little
think
bit,
it's the
and
same
then-
on this side or something on this side. So the same place?
Yeah.
Okay. That feels like muscle, actually.
That's it.
That actually is one of the big muscle groups in your abdomen that we're feeling.
Okay.
As you felt elsewhere, you've got obviously the main big muscle groups which are in the middle.
Yeah.
And there you can clearly feel those in
Yeah.
you. But I think that's what we're feeling in this case.
Right.
In terms of organs,
Yeah.
you have the liver here, and I
Yeah.
can feel that.
Yeah.
The spleen's kind of at the back, right at the back here.
Yeah.
Then you've got your kind of kidneys there. You
Yeah.
can't feel those, they're further at the back.
Yeah.
Your womb would be about here.
Okay.
Bladder and womb kind of all level, and your ovaries will be somewhere like here.
Mhm.
So it's miles away from
Yeah.
where we're feeling.
Yeah.
In terms of what you felt, I'm definitely not at all worried.
Right. Okay.
Okay.
That's You know, as I said,
Yes,
my
no,
friend didn't have anything
fully
like that at all, and
understandable.
she's the same age as me, and it's completely come out of the blue, and it just makes you question everything, I think.
Yes.
But yeah,
How did she find out then? What happened?
So she said in the morning she'd lie down, she'd press her.
Oh, and she felt something.
And she felt a lump, and so she was just like, I really should just go and check this out and just put her mind at rest. And then fast forward 2 months, she's had a full hysterectomy, cervix, ovaries, everything out. Luckily, she's already had her kids, but now she's just recovering from that operation. She kept saying, as long as, if anything comes out of this, if you're worried about anything, you just go and get it checked out. And which is why I came, really, just to sort of, I'm sure I'm probably being stupid, but...
No, but as you
Just
said,
need someone to
it's
tell
worth
me.
checking out.
Yeah.
It's worth checking it. And something you don't know what it is, it's worth checking.
Yeah.
So in this case, it's fine.
Great.
But if you do find anything else, do come back.
Wonderful. Okay.
All right?
Thanks very much.
All right, bye-bye.
Bye.
See you.
It's like musical rooms out here, boy.
They've all just shuffled around, so they're in different rooms, but we're aware of where they are and stuff, so it's fine.
Come in. Hello. You all right?
Up there, around here, and a car, yeah.
Oh no, the room. I get moved around a lot.
Yes.
It's very unpredictable. So, in terms of your blood results, we've been trying to decide whether or not you needed to go and see somebody about this tummy pain.
Yeah.
Over a number of appointments, Leslie and I had discussed his abdominal pain, his diet and his lifestyle.
I buy some, what they call, like chicken nuggets. I eat, like, say, 30 of them in one go.
That's quite a lot. The last set of blood results was completely normal. And I think, actually, you probably don't need to go and see somebody about your tummy pain unless it's bothering you.
Unless the blood tests come back a bit.
No, the blood tests are normal. Because we've talked about your diet quite a bit and the fact that it can be very erratic. I think that you can get some tummy pain if you're not eating a regular and healthy diet.
That's right, yeah. And that's why I go to these nutrition classes. So I've been to a couple and, you know, you learn a lot. Initially, you walk out of the building thinking, oh yeah, next time I get money, I'll go and buy some of this, some of that, some of this, some of that. Because when I get the money, it goes on what I normally buy. I think to myself, well, I should really buy a whole bunch of salad.
Yeah.
And, you know, just eat like a rabbit for a week or a couple of days. You know, that's what you call it, rabbit food.
Rabbit food. I didn't know you were going to nutrition classes.
Yeah, we had one in the house. And,
what kind of house is it that you live in?
It's like a hostel. I was offered a place 2 years ago and I didn't take it.
Okay.
Because of their rules.
Yes.
Their rules being you can't have a beer.
No.
And it's not so much that, you can't have a beer outside. So I'll give that the elbow. But this place here, they don't say you can drink, but if you do drink in the house, just drink in your room.
Leslie and I have talked about his alcohol consumption. I'd really like to work with Leslie to try and help him to eat a healthy diet and to try and reduce his alcohol consumption. So let's conclude. Your tummy pain, you've had it for 20 years.
Well, yeah.
It's not too bad. We know your diet's very erratic, and you've told me nothing like a swallowing problem or bleeding or weight loss, which makes me worry.
Yeah, okay.
Okay?
Yeah.
Lovely. Good to see you again.
Yeah.
So come and let me know if this tummy pain is worsening, and then we can do a referral.
Yeah, okay.
All right?
Yeah. I'll see you in there.
Yeah. Bye.
Where's the sandwich list?
Egg and cress.
No, I don't want egg and cress.
I don't know, something like chicken, like, I don't know, New York.
Tuna and spring onion.
Tuna?
And spring onion. You only do tuna and spring onion, isn't it?
Never had that one before, but spring onion is quite nice.
Hi, Mark.
Hey.
I'm okay. How are you?
Yeah, right, not bad, thanks. Yeah.
Yeah?
Okay, yeah.
Okay.
Yeah. Well, I had my first CBT appointment for 8 months, I think, last week. So just sort of tweaked a few things that I was doing.
Okay.
So I'm just going to try and go to bed at 11 every night and cut out all alcohol, which I've been doing last week.
Mark has suffered with anxiety and depression since about 2012, 2013. He'd previously presented to his GP initially with just tiredness, but then he developed more depressive symptoms and was diagnosed with depression.
Also, I've been keeping like a sleep diary and activity diary. And, like a food and exercise journal as well. And just noting on it when I feel tired and how I feel, what thoughts are running through my head and that sort of thing.
Yeah.
Feeling a little bit better, but sort of mood sort of up and down still, which seems to be, I don't know, I thought I'd sort of, that had improved before, but it seems to still be sort of getting the sort of bit down and sort of suicidal thoughts and things.
How are you managing with the suicidal thoughts? What thoughts are going through your head?
Yeah, just feeling quite down and a bit dejected, I suppose, and just, just thoughts about ending it all and how I do it. But, I suppose they're quite occasional still. They're not like regular, but they're still quite sort of, it can last for an hour or two, sort of thing. I'm quite down and not really want to do anything.
Yeah, and that happens a couple of times a week? Or?
Yeah, It's not irregular. It's probably every other day, every few days, maybe something like that.
And what do you think about what you would do, or what your options are?
Yeah, that sometimes. Yeah.
And what have you thought your options are?
Just sort of running away or stabbing myself or something like that.
Okay.
Yeah.
You know what I'm like.
Yeah.
I will panic.
You're worried if you don't know.
And I'm worried, and I panic, and then I get depressed because I don't know what's going on.
Like if I'm asleep, I quite often wake myself up thinking that I'm kind of choking a little bit.
You're not actually, when you wake up, you're okay.
It's fine, but it's kind of like a panicky kind of thing.
I was going to say, it sounds a bit like a panic attack.
I think you put a bit of weight on since I last saw you, haven't you? Yeah, you used to be a skinny chap.
I did. Well, it's all to do with my inactivity.
Oh dear.
Depression.
Oh dear, I'm sorry to hear that.
I've had a lot of stress over the last couple of weeks because it's the end of our financial year and we've all been scrabbling to try and do our numbers.
Yeah.
I think you're unwell at the moment, and I do genuinely think that you will get better.
Yeah. Yeah.
You know, I do have that hope.
Yeah.
You know, that you are ill, and you know, I think we are getting you on the right track, and I think all credit to you because you put so much effort into getting better.
Yeah, thank you.
As well, you know.
Yeah.
And I think that you will have a fulfilling life again.
Yeah.
Mark is definitely someone who is doing his utmost to help himself, and when patients are really trying to help themselves, it does make our job much more easier, and they tend to respond better as well. Unfortunately, part of the problem with depression is that you sometimes lack that motivation and that drive.
Are you still seeing the psychiatrist?
Yes, but I haven't seen him for about a month.
Okay, so there's that to do. I know we've got to sort your medication.
I just need some more. But I don't know if I need a higher dosage on the sertraline.
You know, in terms of safety, in terms of those suicidal thoughts, like if they get more common or you're taking them that bit further, then please let me know, let anyone here know.
Okay.
Go to A&E, because that's part of the illness, okay? And we won't want you to do anything when you're not, well.
Yes, sure.
You know, that has such serious consequences.
Yeah. Okay.
Yeah. Should we put a review on?
Yeah.
Let's do 4 weeks, because you'll have seen the psychiatrist by then, and
yes,
it'd be nice to know how the chronic fatigue referral is going through.
Yes, sure.
Okay? All right.
Thanks so much.
See ya.
Bye.
Nothing for today, I'm afraid. Oh, actually, I've got a 4:30. That'll be with Dr. Pierce. Yeah. What's the date of birth?
What was the appointment for today?
It's itching. I'm getting these marks around this area. It's mainly upper body and around neck as well.
Okay, let's have a look at the rash a little bit more.
You want to take off?
Yeah, if we lift this up, see where the main bit of rash is. Okay, it's quite noticeable, isn't it? Do they come up as little pustules or?
No, it's the same, but it's very irritating,
Yeah. Okay, and do you share a bed with anybody at home?
No.
Okay. How long have you had the rash for?
This is, I think, about 4 or 5 days, this front side.
And it's very itchy?
Yeah, but the back one, because I can't see it. So...
The back's where it started off, though?
But I think it's not much now, probably.
Yeah, just not a very specific one, but has been itchy on there.
Yeah, but it's a long time. But the last few days, it's just mainly here, and then yesterday I had a very bad towards the neck. It was like here.
Just very itchy around there. And what do you do work-wise?
I'm an accountant.
I'm an accountant, so not exposed to anything
No.
accountancy.
No.
I wonder, just looking at the rash, whether or not it could be a type of rash called scabies, which is caused by a little mite that lives on the skin. It's the sort of thing that you can pick up, sort of sleeping in a hotel bed or anything like that, where somebody else...
It's the same bed I'm sleeping, and it's not being shared with anyone.
Scabies is the name that's given to a condition where the skin is infested with a small mite that lives just under the skin surface. Some of the myths associated with scabies may be that it's a disease that dirty people have, but in actual fact, it's something that we can pick up at any time. This will be something that they would have come into contact with a number of weeks before, maybe really anything up to 6 to 8 weeks before the itching has started.
And yesterday I requested the antifungal cream for because I feel smell down the bottom between legs and armpit.
Let's have a look at the armpits as well. Let's have because we might just try a tablet from a fungal point of view. Okay, and in there, so it's very itchy around here. Yeah, it could be. It's not very classical of intertrigo. And a similar thing in the top of the groin.
Yeah, here. It's not itchy,
Yeah.
but it's a smell.
The antifungal cream tends to improve that, does it?
Yeah. Because it's after a long time I'm having it, because it's worked really good.
Well, let's try a slightly different approach to it, and we'll go down the route of a medication, like a tablet form of the cream. The areas where this is happening, whether or not there is a fungal component to it, it's difficult to know. But we'll see what happens with this rash over the next 2 weeks. Okay.
Thank you very much.
Take care. Take care.
What we can do for you is we can either book the next appointment, which will be next week, or if you don't feel able to wait till then, I can get an on-call doctor to call you today. Are you available to take a call today?
Come in.
Well, it is. It started Monday. I've got an abscess or a boil in my mouth. Can you see where it's swollen?
I can, yeah.
Right. Do you want me to open it up?
Well, when did it start?
Sunday night. Yeah, I didn't think it was. I think it's there on my gum. Can you see it?
Yeah. Let me just wash my hands.
Well, I just washed mine before I came out, but yours are probably cleaner. But I can't figure out why it's affecting my cheek.
So, what did you notice, first of all?
Monday I woke up and I went, what's up with that? Because I wear a little plate, and it's near where the plate is, but I don't think that's doing it.
When did you notice the swelling of the cheek?
This morning. I got up, I had a quick wash and that. I need a bath tonight. But I washed like that. I was in a hurry. I went like that, took those bits off as you do. Once a week, shaved tonight. Yeah. And I got somebody went, what's up with your face? I went, what do you mean? I said, well, there's a big swelling in the right hand side.
Let's have a look then, so. Can you put your tongue on the top of your mouth like that?
I can do that.
Not quite, just at the front of your mouth, so like that. Okay, fine. And then just relax. Okay?
Okay.
And does this, I'm just going to press on you. Does that hurt?
Not in the cheek.
Yeah.
Where is it? You can press the bit that you think it is.
Tell you what, just, can you lift that up? That's
How's
great.
that?
Oh, it's a nasty infection, isn't it?
Oh, well, I don't know how I got it. Brush my teeth and all that.
Can you do me a favour? Can you get both of your hands
And what both
lift
ways?
it?
Right, hold
Yeah.
on, hold on. But how's that?
Yeah. That's great. Okay, fine. When did you last go to the dentist?
So that was 2 months ago. I'd never have any trouble with the
so you
dentist.
went 2 months ago.
Yeah, they put it in. I'm due for another checkup.
Did you smoke?
No, I stopped. I'm stopping. I've seen Mr. Passois at the moment since last September.
How many years did you smoke for?
A lot of years. Since about 16 or 17
16,
years.
so 45-ish years.
But I've been chewing a lot of gum, but that wouldn't do it, would it?
No. What about alcohol?
I've cut back down on that and all.
Have you ever drank in excess?
Maybe years ago. That stopped in the last couple of years, pal.
Okay.
Sorry.
Okay, that's
Yeah.
fine. That's okay.
Maybe I've done something that.
I think the most likely thing is an infection. I agree, it's a bit
Taking the
unusual.
gloves off, and sometimes you go like that if you're sweating on site. You know.
So what, I'm going to give you some antibiotics to treat the infection. Probably be a good idea to try and see your dentist as well.
Right.
Okay. I'm going to give you some mouthwash
Right.
as well
Okay.
to use just to keep it all clean. So you're going to take some ibuprofen 3 times a day with food.
Yeah.
That's for pain and swelling. If you're still in pain, you can take paracetamol on top of that.
It's going to be high as a kite.
In a couple of weeks, if there's any problem at all
Make
with
an
your
appointment.
gum, you need to come back. Because in people who've been heavy smokers, especially if you've been drinking as drinkers as well, we always need to make sure that everything heals up properly, because if it's not, sometimes it can be a sign of something nasty like mouth cancer. Okay? All right.
Thanks very much for your
All
help,
right.
Doctor.
Pleasure.
Shan? I'm saying it wrong, isn't
Shan.
Shan.
Yeah.
Shan. Right, Shan.
All right.
Thank you very much.
Bye.
Aaron speaking, how can I help?
Have you brought a urine sample in today?
No, I didn't.
One of the tests is a stool sample. Okay. So you'll need to drop that off for us if you don't mind.
Are you able to provide one quickly now?
It's touch and go. I can try.
I've brought a sample because I hope I'm pregnant. Okay. Yeah. Good.
Don't know if you need that.
I don't actually,
Okay.
but no, it's good to bring it. We don't tend to repeat them here, but I'll ask some questions. The tests that we do here are exactly the same as the ones you buy over the counter. So, when was your last period? As the first question.
29th of
What do you mean? June. Okay. And your periods are normally quite regular, are they?
Well, they are, apart from, I don't know if you've seen, but I've had 2 miscarriages and one was recent, so I actually haven't had a period since the last one.
So that period you're saying on the 29th of June was...
Yeah, the miscarriage.
Miscarriage, okay. Yeah, I'm sorry to hear. I saw that. I didn't realise you'd had one before as well. When was the previous miscarriage you had?
It was
April. Okay. And were both of them early in the pregnancy, or...?
The first one was about 8 or 9 weeks.
Okay.
And then the last one was like 6.5, 7 weeks. So.
Okay, so you must be very pleased you're pregnant and also
no, I'm
quite worried.
absolutely terrified.
Are you terrified?
Absolutely terrified.
Miscarriage is quite common in early pregnancy, particularly in the first trimester, which is the first 12 weeks of pregnancy. Clearly, it's always very upsetting whenever a miscarriage does happen, and it's understandable at her reaction at being very worried about this new subsequent pregnancy. However, having one miscarriage does not significantly increase the risk of having a future miscarriage.
Any little twinge, I'm like, oh.
And what happened last time? Did you have some bleeding or pain, or how did it come to light?
So the first one, pain and cramps. Well, the first one started with sort of a little bit of brown discharge, and you know, you convince yourself that that's okay because it could just be old blood, etc. And then, but I did sort of have period pains, and the second one was earlier, and it was the same sort of thing.
What a hard year you've had. That's...
Oh, I know.
No, not good. Okay.
I saw it this morning.
I know you did.
Well, what with my foot and how I feel, I don't feel good at all. That's why I left a message this morning that I thought I had some more steroids, but I haven't. So that's what I need, I think. It's been a job to breathe. Breathe through my mouth, not through my nose. It's been blocked up.
Your nose has?
Well, I keep blowing it, you know. But
okay. And how long have you been having difficulty breathing for now?
A couple of days.
A couple of days?
Yeah.
Okay. You seem more breathless than normal.
Yeah, I am.
Yeah.
I can't do anything without sitting down.
Okay.
All right if I sit for hours, I can't do that.
Can I just check your temperature? And check this side.
I don't think I've got
No. Have you been managing to look after yourself?
Yes.
Yeah? Can I pop your finger in there?
And my foot is killing me.
Have you got an appointment yet?
I've had it. I phoned them up.
Yeah.
They gave me a boot. Well, that's a joke.
Ah.
I tried wearing it, and what that does, it takes you off the floor that much.
Right.
So your hips ache because you're walking out all out of line. No good. It is very difficult, very soul destroying.
I think the hard thing is I don't think there are any other options really.
Well,
apart
that's what
from painkillers and time. Your oxygen levels are quite low today. They haven't been this low for a while. One option is to go into hospital.
What can they do?
can't cope. I wake up 3 times a night and my partner is waking up. It's just getting worse and worse. I can't just breathe because constantly being blocked.
I sort of feel wheezy and, you know, sort of, I always need to sort of cough.
Just feels almost like I'm sort of gasping for breath. It feels like I'm just kind of restricted.
Lips tight on the cardboard bit, and then fire the air out fast.
Okay.
So it's a real...
I like your dress.
Thank you. It's new.
Nice. Nice and bright. Nice.
If you sit forwards for me. And just breathe in and out for me.
I had blood test this morning.
Okay. So obviously your breathing's not so good today. It's quite a lot worse than normal.
Yes, I know, but what I can do.
And your oxygen levels are quite a lot lower than normal as well. One option is to go into hospital. The other option, which is potentially more risky, is to try and look after you, you know, here and at home.
Well, if I could have another go here at home.
Okay.
The benefits of staying at home compared to going into hospital is that there's less waiting around. It tends to be a less stressful environment for their recovery. Also, they tend to sleep better as it's less noisy. And also there's a reduced risk of infection. If we felt it was safe for somebody to stay at home, we would always try and keep them at home. But obviously we need to take their wishes into consideration as well.
If you tell me exactly what I've got to do,
yeah, okay,
then I'll do it.
Yeah, I'll ask the respiratory nurses to come and visit you tomorrow.
Yes.
Okay, but if you have any problems, call the surgery as well.
Okay.
Yeah, because we can
What
help.
such as problems?
Well, look, if your breathing's getting worse or you
Yeah.
can't manage at home.
Yeah, well, I would tell you.
Yeah. Okay.
Thanks a lot.
All right.
Yeah.
Pleasure.
Thanks very much.
I'm seeing you next week, aren't
It
I?
was raining when I came.
Looks
I
like
had
it's
to back
stopped
off.
now.
I think it's all right. Thanks, Doctor.
All right. Bye.
Thank you.
By the way.
What may be worth doing, given your history, is getting you an early scan in the pregnancy.
Yeah,
so
that would
we
be
can
good.
check everything's going okay.
Yeah, that was one of the things I wanted to talk about, and then just if there's anything that I can do. Obviously, I'm willing to just try. I've stopped running, which probably I don't know if it's a good thing or a bad thing. I'm really trying to do everything I can, so at least then I can say to myself, with nothing I've done.
Yeah, and I think that's normal to do that, and I think that's probably an appropriate thing to do. There isn't any evidence that running in any way will affect or doing sport will affect it, but human nature being what it is, it's not. If that's the decision made, that's fine to do that. Yeah. To be honest, whether it makes it better or worse, it's mostly out of your control because it's more to do with the DNA of the embryo that's forming rather than anything that you were doing. I think it's really, really hard when you've had such a difficult year. I think the best thing we could probably do is figure out your dates now and try and get you a scan about 7 weeks so we can see, and there's an early pregnancy unit at St George's.
So what will they be able to see at this early stage?
And hopefully at 7 weeks you should be able to see a heartbeat, you should be able to see a gestational sac in the womb, and if they can't, what they would do is then bring you back the following week so they could scan you again.
Okay.
All right.
Cool.
Okay.
All right.
Do you want me to dispose of this?
Yeah.
Yeah. I don't really want to carry it around.
Lovely.
Okay, well, I hope it all goes well next week.
Yes,
Okay.
I'll let you know.
Good.
Thanks very
All
much.
right. Bye.
I'm not too sure. Bear with me a moment. Is ear syringing messy?
Messy?
Can it get messy? Yeah.
No, they won't get messy.
No, it won't get messy, no. All right then, okay. Bye.
So have you had your ear syringed before? No. Irrigated or anything, no? It's not a painful procedure, it's just feels a bit weird, warm water in your ear.
Okay. Yeah.
Just come and take a seat over here. Thanks. So if it does start to hurt, because it's not supposed to, then let me know and I'll stop. I'll put this here, don't get wet. Hold this cup under your ear like that for me. Look straight ahead. Keep your head just like that. Like that, straight ahead.
Yeah, cool.
You ready?
Yeah. Oh, wow. It was alright, actually.
There it is. Quite little lumps come out.
Oh my day.
What?
Oh my day. That sounds bizarre.
How does it feel?
I can hear you sound like you're shouting.
Have a look in the cup if you want. Does it feel good then?
It feels amazing.
There you go. Let me have a look in quick.
Oh my God.
That's the best reaction I've had.
I'm gonna listen to some music tonight.
Yeah, enjoy. All right, let me just move you around here just a little bit. That's it, and then out. All right. Let's look straight.
Yeah.
I'm gonna begin, yeah?
Yeah.
There we go. Wow. Wowee. That was even bigger.
Seriously?
Have a look.
Oh my goodness. Oh my God.
What? The hearing?
Oh my goodness.
It's weird, isn't it? Let me have a look.
That is amazing.
Let me just look.
You don't value
Your hearing.
your hearing until it gets taken away from you, like from the guts or something.
You see the big lumps in there?
I see.
Mm.
It feels weird. I can hear myself inside.
Right, there you go. 2 crystal clear ears. Oh, sorry.
Oh my goodness. I'm meant to feel like this. I can hear myself inside.
Because you're not used to having normal hearing. They've been blocked up God knows how long.
Yeah.
So this is how sound should usually be.
Okay. Oh my goodness.
There you go. Happy?
Yeah, I'm more than happy.
Good. There you go. All right. Take care. If ever you need it done again, you know what to do. Take care.
All right, nice to see you, Barbara. Bye.
Nice to see you. Okay. Take care. Bye-bye.
All right.
Very much.
No
Love to
problem.
see you.
That's okay. Thank you.
Okay, I love you. Thanks for seeing me.
No problem.
Yeah, thanks a lot.
Take care.
If I could see patients all day, every day, and not have to do anything else, I'd be a happy woman. Have you spoken to anyone to try and get some help?
I don't think speaking to anyone will help.
The problem with prostate symptoms in men is that it's quite embarrassing in their eyes to come in for the intimate examination. Would you mind if I examined your prostate today?
I love working here. Every 10 minutes, I can make a difference to someone's life.
I've tried to take my life so many times. Nothing seems to be curing it, really.
I do smoke a bit of puff.
What do you mean by a bit of puff?
A bit of marijuana.
Your 10:30 is late as well.
Okay, I mean, I can see the son now then, because he was the first appointment.
Right.
Gordon Runham. Right, just take a seat. Right, so how can I help?
I don't know how to say it, like, you know when you get dizzy, yeah? But not dizzy, like lightheaded.
Like unsteady? As if you might fall down?
Yeah,
or?
like lightheaded, like it's I'm not getting enough blood or oxygen to my brain, you know what I mean?
Okay, and is your vision straight?
Yeah. It just feels like a bit distant, you know, like, like it feels like I'm going to pass out.
Really?
When I breathe in, it's that's when I get it. Like everything becomes a bit tight on the left-hand side of my
Oh, right, okay. But it's mainly when you breathe in. Okay. Just have a listen to your heart. Deep breath. And out. And out. Good. Just take a seat there. Relax while you're having your blood pressure done. I'll explain it to you. That's good. So, what happens when people, particularly young patients who are fairly fit, breathe in? The heart rate slows down. And when they breathe out, the heart rate speeds up. And it's called sinus arrhythmia. The amount of blood that each heartbeat pumps out is bigger. Your heart beats less often. Your blood pressure also might fall slightly, and it might give rise to this slightly lightheaded feeling. So your heart rate slows from about 72 when you're resting, and when you breathe in, it slows to 60. Right. And then when you breathe out, it comes back to 72.
Right.
Roughly. But it isn't abnormal. If you don't understand what it is and you become anxious about it, that
makes it worse.
Can be magnified. That's right. That's all it is.
So what's the dizzy? Why do I feel like...
It's because when your heartbeat changes, there's that lag period where it catches up in terms of glucose and oxygen in your blood to your brain.
What about the breathing as well? Is that just a bit me being anxious?
Correct. That's what it is.
Yeah,
so in this situation, it's a normal phenomenon. Our job is to distinguish between something that is important and something that doesn't need any medical intervention and isn't indication of disease.
Yeah. Is that it? Sorted?
That's it.
Cheers, Doc. Thank you very much.
Yeah, nice to see you, yeah. Yeah, you take care. Bye.
Hold it. Hello, how are you?
I'm feeling good.
You're feeling good?
Yeah.
Why are you here?
I sleep there.
No, I don't tend to sleep there.
He has a bit of a cough. It's been on and off for a few days. And it's just it's starting to get a bit deeper, a bit more pronounced.
Has he had a fever, do you think?
No, not really. Just a cough.
And what about eating? Is he eating okay?
Not really. It's just less and less.
Has he had chest infections or anything like that before?
Yes, yeah, when he was a lot younger, perhaps 2 or 3.
Do your ears hurt you? Are your ears okay?
Yes, my ear's okay.
Okay.
And my nose and everything.
Everything's okay?
Yeah.
All right, fantastic. Can I just take your temperature? It ticks like a clock, all right? That's fine. I didn't hear it ticking though, did you? It's all right though. I haven't got a fever.
What's that?
Just takes your temperature.
Is it my brain? That's my heart.
Your heart's on the other side there, look.
Yeah.
Yeah. Can I just put this on your finger? It doesn't hurt.
Tickles.
It tickles. I'm checking oxygen levels in your body. That looks fine. Thank you. Can I look in your ears? You look very smart today.
That's so tickles.
Can I look in the other one? That's it. Pop your tongue out. That's lovely. Well done.
Do you check my heart?
I'm going to check your heart if that's okay. Oh, it's a bit of a tickle.
Do you hear that?
I can hear your heart, it's fine.
No.
Again. Yeah, he's got a chest infection. I'm going to tuck your label in, all right? So he needs some antibiotics. Okay.
I got a chest.
You have got a chest infection.
Hello. Sit down, please.
Okay.
Take that.
Thank you, Dad.
So it's going to be 4 times a day, okay?
So do you reckon it'd be a bit advisable just to keep him in today?
Yeah, I'd keep him at home.
Sure.
Have a nice rest today, yeah?
Yeah.
You've got a cough, haven't you?
Right,
it's lovely to see you, and I hope you feel better soon.
Bye.
Okay, good boy. You've been fantastic.
Thank you
All
very
right,
much.
thank you.
So just go down, quick, pharmacy down
Pharmacy's
here.
just down there, yeah.
Thank you.
Bye.
Samantha Holmes. How are you?
I can't take this anxiety anymore.
Go on.
Just this constant feeling of doom and just... My chest feels really tight. And those pills, I was hoping that they would help, but...
What's made things so bad?
There's nothing that's triggered it, it's just... I don't know. It's horrible because I'm constantly feeling like jittery and when you asked before if I had suicidal thoughts and stuff, I said no because I didn't want anyone to think that I'm some nutcase, you know. But I used to self-harm and stuff. Yeah.
Have you done anything recently?
No, I haven't done anything in a while.
So what sort of thoughts are you getting?
Just... I just feel like if I wasn't here alive, things would just go on smoothly and there would be no problems.
How are you doing from the point of view of diabetes?
It's my blood sugar level was high.
And it's high again.
Well, it's funny that.
Diet-wise, are you conscious about what you have, or...?
Cut down on my beer, cut down on bread. I've had no sugar for 9 days on my cereals.
I do cheat every so often and have a sweet. Yes. Do you have alcohol, sir?
As much as I can get down my neck.
If your blood sugar went down...
and you feel a bit wobbly and a bit dizzy...
you would know that you need to get a chocolate bar.
Some jelly babies...
Don't tell me to lose weight because it's not happening.
I have lost around 9 kg.
Well done you there, you're amazing. I'm really pleased. Richard Baker. Come and take a seat. So, how are you?
I feel a lot better than what I did.
I'm not surprised. Your sugar's very much better.
Oh, good.
So, when I saw you February time, it was up at 113.
Yeah.
Up here.
Yeah.
It's now come back down to 84.
Oh, so it's...
So those tablets are working?
Yeah, good. Yeah, I lost a little bit of weight when I first went on them.
That's right.
But it's evened out a bit since.
Okay. So no problems with the waterworks with them?
I've still got the problem of getting up too much at night, but nothing otherwise, I think. Yeah.
Good. Shall we do your weight? Well, just to see what it's doing, don't worry. So take a kilo off for your shoes. So we said 113. Wow, you've lost 5 kilos, so that's about 11 pounds. That's really good.
That's more, yeah. Well,
that's very good.
From scales, yeah.
And you'll be feeling better as well because you've lost the weight.
Yeah.
Okay. I think it will continue to come down, you know. I really do. You do look very much better. Losing a bit of weight at your age, it helps with your joints, helps with your mobility. It just generally makes you feel much better, so...
Yeah. So the only concern I got is getting up so much at night.
How many times are you going in the night?
I get up about an hour and a half after the first time I go to sleep.
And then how many times?
And then it gradually extends 2 hours, 2.5 hours.
The prostate warning signs are mainly to do with how you pass urine. Men will notice going to the toilet more often than they normally do. When they go, they're not passing as much as they normally do. Or the stream isn't as strong. They'll also find that they are getting up several times in the night to pass urine. Would you mind if I examined your prostate today?
No, that's right.
The problem with prostate symptoms in men is that it's quite embarrassing in their eyes to come in for the intimate examination. They don't like to admit that they have a problem. And if we catch prostate cancer early, we can cure it. So I would like to say to all men out there, if you're having symptoms, please come to us. All right, take a deep breath. That feels smooth, so that's good. Let me just wipe the gel off. It's a few seconds of embarrassment and then it's over and done with, and we could change your life. We're all done now. Just get up carefully, don't topple off. Okay, you need to sort yourself out. So I'll put the request on the computer for you to have the prostate blood test done, but book that in for a week, 10 days' time.
Yeah.
Is that okay?
Yeah.
As regards your diabetes, we'll see you again in 6 months.
6 months?
Yeah? I'm ever so pleased.
Yeah.
Really, really good. And you look really well, which is great.
Yeah.
Obviously, being up north is good for you as well. Yeah.
Right,
Take
thanks
care
for
of yourself. Bye-bye.
Come through.
That's okay.
So you're...
I'm going to sit there, yeah? Righto.
Okay.
Yeah, I was referred to by Dr. Butt from Weeks Drive
Oh,
surgery.
okay. Fine.
So it's to do with that.
Okay.
I used to suffer from acne, and I've always had like a little thing there. And I was shaving one day, and I must have got some dirt in it, and I'm never bothered about it.
Yeah.
I just wondered if you could
Yeah,
possibly get rid of them.
I'll see.
Or give
what
me
I can
something.
do. Yeah, okay. So do you mind if I feel around the area? Just see. Does it cause you any pain at all?
No, no.
Have you tried squeezing it?
No, I didn't want to.
It looks like there's a keratin plug in there.
Yeah.
And from looking at it on the surface, it looks like something called a comedo, or comedone, basically, is where you can open it. And it's sort of like an open pore. So what I'm going to do to make it more comfortable for you is get you to lie on this couch.
Oh, right.
Yeah.
You can have a go at it, are you?
I'm I'm purposely not going to cause you pain. And if I do, then you must tell me to stop.
No, no.
All right? Okay, so lie on your back.
Yeah, okay.
And this is more for me to get an idea of.
Yeah.
But occasionally this is...
Yeah.
It can be quite useful to get an idea of what the consistency. So in that area, there is sort of a firmness.
I'll tell you if you hurt me, but you carry on.
Can you see that's sort of the area where there's sort of this sort of plug inside the middle? You can sort of squeeze and dig these things out, but is that causing you pain?
No, I had an itch. It's all right, carry on.
You had an itch?
Yeah, go on, carry on.
So I'm just trying to see. So this can be, there are different ways, but just trying to see. So you can see there's sort of one of them. Now this is something you can quite safely do at home. Is that causing you pain?
A little bit, but if you can get it out, I'd rather go through the pain and...
Because this might be difficult. So over time...
It's probably better that you're doing it rather than me.
So you can see this sort of keratin consistency coming out.
Okay, yeah.
So you feeling okay?
Yeah, I'm all right.
I haven't done very much. It was more just to see what consistency was in, and you can see that.
Yeah.
But if you kept doing that over time, it will tease itself out.
It'll come out, will it? Okay.
There are some things that I can give you that can sometimes help break down that area.
Yeah.
What I've given you there is a dapaline cream, which
Yeah.
is to be put on at night time.
Okay, fine.
If you find they're becoming very painful and nothing's progressing, then come back to
It hurts
us.
a bit now because you've been squeezing it.
Yeah,
That's all right.
I'm really sorry.
Don't worry about it.
Bye-bye. Thanks for talking to Patrick as
That's
well.
all right.
Thank you.
Okay,
Bye.
Thank you, Chris. Anyway, have a nice day.
Morning.
Tierney O'Shea, please. Hi there.
Hi.
All right, sorry for the wait. I'm Dr. Taylor.
Hello.
How can I help?
Well, it's coming up to 7 weeks now that Tierney hasn't had a voice. She had a terrible cold, very, very sore throat.
Yeah.
She was given antibiotics because it was on the verge of tonsillitis.
Okay.
Swollen tonsils. And then it went into laryngitis just after that. I brought her back. I was told it would clear. Still nothing seems to be curing it, really.
Is it still sore? Okay.
The only benefit she says that she has is when she's in lessons, she doesn't have to answer questions.
Shall we have a look? So you're not having any fevers at the moment, otherwise you feel quite well in yourself? Yeah. Just going to have a look at the back of your throat. You know the drill.
Not nice, I know, darling. Bless you.
Can I have a look in your ears as well? Okay. And the other one? Press that into your neck. Is that sore? No. Okay. Let's just have a quick listen to your back of your chest as well. Do you want to just turn around? Okay. So, your throat doesn't look too bad. Your tonsils aren't up. There's a little bit of redness at the back there, but otherwise it looks okay. And your chest sounds fine as well. So I think you're right. I mean, this classically sounds like laryngitis. Obviously, it's quite prolonged.
Yeah.
To be honest, at the moment, apart from it being laryngitis, I can't really think of anything else that I think would be more worrying that we need to be ruling out here. And in the absence of any pain there or any obvious swelling of the tonsils, it doesn't look like there's any active infection
Right, okay.
there. And I think what we're seeing is the aftermath of the infection that was there just over a month ago. The only other thing that potentially we could do is get an ENT doctor, so an ear, nose and throat specialist, to put a camera down the throat and make sure that there's nothing else going on down there. But that would seem a bit mean for something that I'm pretty sure is still just the after effects of a virus.
I understand that.
Yeah.
But obviously this is going on for so long and I want it looked into further to see, you know...
Do we have your correct contact details?
Yeah. Okay.
All right.
That's great, Doctor. Thank
No
you
problem.
so much.
Take care.
Bye-bye.
Bye.
Don't feel so hard on yourself. You've done a great thing by looking after your mum. You are doing a great thing. And what about in terms of supporting you and with everything you have to do?
There's nothing I can say or pinpoint that says, okay, that's what's causing my anxiety or, you know...
It's just everything.
Yeah.
Yeah? Okay. So you're going through a bit of a tough time. But it will get better. If you want it to. You want it to get better?
Well, of course I do.
Okay.
But
so you don't think talking to anyone will help? So I take it you didn't call talking therapies? Okay. So what we're going to do about your medication?
I don't know.
Sometimes there's another medication that we can use, which doesn't really help with what's going on up here in your brain, in your head, but can help with the physical effects, so that actually just calms things down a little bit so you don't feel so heightened anymore. And we can actually give it in conjunction with the fluoxetine. Do you want to give that a go?
I'm willing to try anything at this point.
Will you come back and see me in a few weeks? Yeah. Okay, because I haven't seen you in a long time. You've not touched base. I'm going to ask you again. Got any plans to do anything silly?
No.
Okay. Do you need some more fluoxetine?
No, I'm fine with that.
So I'm going to ask you to take 3 every day, and then I've updated your records for the next time that you ask for one.
Okay.
You can have some more, okay? I want to see you back in a couple of weeks. So don't worry. We're going to be all right. You're going to get through this. And you're going to start feeling better soon.
I've heard that so many times.
Okay, let me rephrase that. If you want to get better and you want to start feeling better, then you will. It's just going to take a bit of time. Okay? So keep talking to me.
Okay.
No more going off. All right?
Yeah, thank you very much.
Take care. Antidepressants work for some people and don't work for others. Given the right support, given the right psychotherapy and positive enforcement and encouragement, people can recover.
Yesterday I woke up with my ankle was swelled up in it, and it's very hurting every time I walk.
But you're not registered with this yet?
No, I've only just moved there.
Do you know where Upton Walking Centre is in Slough?
Would you be able to print me out for a little map?
So, how are you feeling? How are you keeping with regards to your chest?
Yeah, not too bad. It's still alive. I do have a cough, and I do cough loads out, especially if I'm waiting to go to bed and I take my inhalers. Oh, mate, does that clear your chest out?
It's just part of the disease process, COPD. It's just
because of damage to the cells in the airways, they do produce more mucus. Keep drinking plenty of water, because if you get dehydrated, it can be quite difficult to bring up because the phlegm dries out.
This don't trust me.
Yeah.
I drink about between 5 and 8 cups of tea, in big mugs, every day, guaranteed.
Good. So how many are you smoking now, Michael?
I've had 3 or 4 so far today, roll-ups. I do smoke a bit of puff still.
What do you mean by a bit of puff?
Bit of marijuana.
Oh, right. What colour's the phlegm normally that you bring up?
Green.
How's the breathing though?
Terrible. Tube in mouth, pinch your nose, and then just blow out nice and slow and steady. That's it. Keep going, keep going, keep going, keep going. As much as you can. Squeeze it all out. Good, well done.
Was it? I thought that was rubbish. What we should probably do is change that nasal spray to something different.
Gunpowder or something.
Gunpowder, yeah.
Sounds a lot better than last time.
That's probably because I cleared it all last night.
Yes.
Cough, cough, cough.
I've had it so long, I could just put up with it. But no, I do like puff before I go to bed, then I can go into sleep.
That helps you sleep.
Yeah, it's the only thing, yeah.
So relax, blow first. So big breath in, tube in mouth, pinch your nose, and blow out nice and slow and steady.
I can't breathe out my nose anyway.
Oh, right, okay. So keep going, keep going, keep going, keep going, keep going, keep going as much as you can. Good. Right, try and get it right in your mouth. You seem to be pursing it a bit sitting it on the end of your...
I thought I was kissing it.
Yeah.
I know. I'm too much of a gentleman.
Right, go on then. That's good. Keep going, 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 keep going.
Nothing left. They're empty. No more.
No, that's fine. No.
You made my day, thanks.
Okay. So,
did I pass my MOT?
well, it is a bit worse, I think, than last time, Michael. Your ability to blow out the full volume is the same. It's just your ability to blow out forcefully that first second that's gone down. You know, I think the only thing that you can really do is to stop smoking to try and stop this from getting any worse, really.
Yeah. I don't even want to take that vape thing, really.
No.
That's
have you done the pulmonary rehab course, Michael?
No? What's that?
It's a 6-week course at Upton Hospital, and then they'll give you lots of different exercises, techniques to cope with your breathlessness.
How long are you in there for each time?
2 to 4 hours, I think. So
2 to 4?
Yeah, I'm not quite sure, but...
Go on then, refer me. Okay
good.
then, Doc. Thanks, Julie.
All right, so keep...
Okay.
yeah.
All right.
I'll refer you to pulmonary rehab and, yes.
Rehab, I like that.
All right, take care, Michael.
Fill me in. How are you?
Well, to be truthful, I couldn't write anything down because it doesn't bother me.
Okay. This is the prolapse we're talking about, yeah?
Yes.
Yeah. Yeah?
The only time it bothers me is when I pass water and wipe myself. I can feel it, but not every time.
Louise is one of my patients who is 91. She's a sprightly 91-year-old who has seen me over many years, really, for a prolapse of the uterus. If this were the uterus, that's the body of the uterus or the womb. This is the mouth of the uterus or the cervix from where the smear is done, for example. Occasionally, when the supports are weak, the uterus can actually descend down into the vagina, sometimes to the external opening of the vagina, and can even be seen outside the vagina in very severe cases of prolapse. So let me just recap. You had a ring pessary for the prolapse, and then every time we had a problem, such as a little bit of bleeding because the ring was causing you a problem there, we took it out. The treatment of a prolapse uterus varies depending on the degree of prolapse. So we would send them for physiotherapy. If physiotherapy doesn't help, there is an option of surgery available, but there are some women who actually don't want to have surgery. In that event, we can actually offer a ring pessary to a patient. A ring pessary essentially is like a little bracelet. It's made up of PVC or plastic, and it sits in the vagina, at the top of the vagina, supporting the uterus.
I mean, is there any harm in not having it in?
Not at all. This is why I said to you last time that let's do this exercise where without the ring pessary, you can actually then decide, is this prolapse really bothering me? And you've just said that it actually is not troubling you that much. Put anything in there.
Does it get any worse?
Very good question. So the prolapse can get worse if you get constipated.
I am trying, because I have piles and that causes me.
So are you constipated? Are your stools hard?
No, I'm not. Because I take lactulose.
Perfect.
Yes.
So make sure that you do not get constipated.
Yes.
Take the lactulose regularly, because when your stools are soft, you're not straining to pass stools.
Yes.
And when you're not straining, you're not pushing bits of the vagina further down.
No,
okay?
I understand.
Obviously, don't lift heavy weights, but I don't think you're going to be going around lifting heavy weights. And of course, if you had more children, you might.
I don't think I will now.
You don't think you're going to have any children now, so that's exactly.
What I was going to ask, my sister wants me to go and see her in Canada.
Okay.
And with this, I'm a bit concerned.
With the prolapse?
Yeah, would it be all right?
Yeah, perfectly. It's not going to bother you on the flight, because when you sit down, it doesn't bother you.
No, that's right.
It's not really going to get worse. So long as you take all your medications, take your lactulose and make sure you're not constipated.
Definitely.
So I can't see that being a problem. You just need to relax and have a good holiday.
Thank you.
Yeah, absolutely.
Thank you very much, Doctor.
It's always a pleasure to see you.
Come on in. How are you getting on?
Oh. Life's just it's just dragging, it's boring.
And the weather doesn't help, does it?
I can't do anything, I just feel trapped in my body, you know what I mean? Really do.
You'd recently had your procedure done with the gynaecologist.
Yeah. From the operation, would I get any infection from that? Having utensils as such put inside me. I felt a bit uncomfortable and a little bit sore afterwards, and I still feel a little bit twingy now.
Yeah.
A bit,
I think if you had an infection, you'd probably know about it. Often you get sort of quite severe pain or a lot of foul discharge.
No.
So if that's not really happening, it's unlikely.
A little bit,
yeah.
A little bit sore, a little bit itchy.
Thelma had a hysteroscopy recently, a procedure that a gynaecologist would do, where they essentially have a closer look at the inside of the womb and look at the health of the lining of the womb. They use a small camera on the end of a telescope. In Thelma's case, they also did a biopsy, which is where they take a sample of the lining of the womb and send it off to the lab just to make sure there aren't any cancerous changes, for example, in the cells of the womb. And is itch around the vaginal area?
Yes.
Okay. I mean, one thing we could try, because it sounds like this potentially could be thrush, for example.
Yes.
And that's often what causes itching. I could give you something, a cream and also a pessary to put inside.
Cream and pessary is no good.
No?
I can't exert them.
Right, okay. I can give you a tablet.
I can't bend. Yeah, a tablet would be fine.
Yeah?
Yeah.
Okay.
There's nothing I can do to get there at all. Bending is out of the question. Because I've just had last year a toilet, and I think I told you, I had a special toilet in my house.
Uh-huh.
For £3,725.
And what's special? And what's
special about it?
So is it
you asked me that. Well, you sit on it, so it washes you, and then as soon as you stop your elbow, the one. So
Okay.
you stop, it dries you. Little hand comes
That
out.
sounds very high tech.
It's amazing. I love it.
All right. So that's the tablet for the.
Lovely. Just stop being comfortable.
Yeah. So it's just a one-off tablet. All right. It was nice seeing you again. All right.
Okay. Thank you.
Take care.
God bless.
All right.
Yeah.
You know that clock in the pharmacy?
Yeah.
At Mouse Dragon?
Yeah.
I bought that.
Did you? Oh, it's lovely.
How can I help you today?
I lost my friend about 4 or 5 weeks ago.
Oh.
I haven't been able to sleep since.
Was she a close friend?
My best friend for 35 years. So I can't sleep at night very well. I keep getting bad headaches. My body's all hurting. I've got osteoarthritis anyway, but I think with the stress, my whole body's hurting. Like some days I can't just walk.
Have you tried some physio for this joint pain? Have you been referred to physio? Looks like it's been going on for many years now.
No, I've had this for about 10 years. There was a stage before they actually found out what was wrong with me. I couldn't walk.
I can see that you were referred to physiotherapy quite a few years ago, and then
Yeah, it's quite a while ago.
2012. Might be worth doing that again.
Okay.
But with regards to your sleep, it's easy to just give you a sleeping tablet, but that's not going to help the situation.
I'm trying to get over it. It's hard because she was part of my life every day.
Do you think you need some counselling? That's something you could probably try. You can self-refer.
I suppose I could, yeah.
So they do bereavement counselling. Shall I give you the contact details of the talking therapies?
Okay.
Yeah, and then you could probably contact them directly because you don't need a doctor's referral.
Okay.
We need to address the primary issue. So counselling might help if you're still struggling. They do bereavement counselling separately. Yeah. So I'll give you the number. And you can self-refer. All right? Take care. Be strong. You've had many good years with your friend.
Very good.
Yeah, so you have a lot of, good memories to cherish. And everyone have to go, but it's the way how we deal with the loss, isn't it? It's difficult, but they say time is a healer. Okay, be strong, all right? Okay, Chan, you take care.
Thank you so much.
You're welcome.
Thank you.
Take care. Bye-bye.
Thanks a lot. Bye.
Just give me 1 second. Excuse me, ladies. Hello? Any help out here, please? Thank you. How can I help you?
Doctor, I've been bleeding.
Okay.
I am so desperate. I need something to help me.
When you say you've been bleeding vaginally? Vaginal
Yeah.
bleeding? Okay. And are you bleeding very heavily then?
Yeah, because I've had 2 different types of medication prescribed.
Okay.
But I think none of them have actually worked for me.
Okay.
I am so desperate. I am dizzy. I am weak.
Okay.
My problem is because I've been bleeding for, it's almost 2 months now.
Yes.
And, I tend to get sore.
Yes.
So I feel like I'm losing so much blood.
Okay.
So that's where my concern is.
That's your worry, is it?
Yeah.
Okay. Well, we did do some blood tests recently, and they were okay. They showed that you weren't anemic. You weren't losing too much blood. Okay. Let me just check your blood pressure today. Make sure that's okay.
But doctor, do you know why I'm so tired, so dizzy, and all that?
That might be to do with the bleeding. It might be the hormones. Okay. Do you have much stress?
Yeah, kind of.
Stress is something that can make people feel very tired. Where is the stress coming from, do you think?
I've been on the medication for a long time. I've been on medication for a very long time. But I stopped it myself because I thought, maybe the medication were not working and I needed to, just say to myself, maybe I can do it. But I think sometimes at one point I get discouraged and I've tried to take my life so many times.
So you're getting really anxious?
I get really anxious.
I was in an office, I had to let go. I was in liability on my painkillers. I was not well, I had to let go.
My anxiety's dropped a lot.
You're not feeling as panicky?
Not as bad, no.
Do you have to ask about things like self-harm and nothing like that?
No, I've just got it all under control at the moment.
You've been okay on the higher dose? It's not upset you?
I'm actually laughing.
And coping?
And coping.
It's not as bad as it used to be, but sometimes I really get to that point where I feel like going back to that stage, but I try to put myself together.
Well, even if you don't feel as bad as you used to and you don't necessarily feel like taking your life, you can still feel tired and down. And
Yes,
just because it's not as bad as it was doesn't mean to say it's not causing you to feel quite tired and weary a lot of the time. That's probably the cause of you feeling like that. But we can do some more blood tests just to make sure you haven't got other vitamin deficiencies. other diseases that we've not tested you for. Your blood pressure is actually okay, so you're not losing too much blood to make you faint and dizzy.
Is there nothing else? I am tired of, I'm so sorry to say this, but I'm tired of wearing pads.
So let's go back to the medications that you were prescribed then. Did you try, how long did you try the tablets?
The first one, they asked me to take it for 7 days, but I took it for more than 7 days because I had to take it because it was still, you know, but at one point, it was working. Okay. At one point, I thought it was going to stop.
Yes.
And then it started again, and then I took the rest of it.
Yes.
So I thought when I finish it, it's going to stop. Then it stopped, and then started again.
Okay. So we could put you back on that one?
Do that? But this second one hasn't worked at all.
All right. Let's go back then to the one that did work. Okay, so just start taking that every day.
All right. I'm so grateful, Doctor.
That's
Thank
all
you.
right. Okay, and keep taking them then until after your appointment.
Okay, thank you.
Okay,
Thank you, Doctor.
all right. Okay, thank you.
No.
No. But
Come in here. Come and take a seat.
Thank you.
Right, mate, what can I do for you?
I've got a problem. I think I'm getting like some kind of flu or illness. And the biggest problem is my throat because I feel quite a big pain when I'm trying to swallow.
How long has it been like that?
About 8 days now.
8 days?
Yes, I've been taking some tablets, paracetamol recently.
Stand up for me. Open up wide. Dreadful. Yeah, I agree.
Obviously, I just come back from the holiday.
I'll have it.
I just start feeling really, really bad.
Have a stand up for me again. Just want a quick feel. Are you coughing much or not?
No, not too much now. I just feel the pain when I try to swallow.
Your throat is really swollen, it's really inflamed, and you're developing little bits of pus on the back as well. So you're getting like a tonsillitis, if you want to call it that.
Now, so it's a bit better.
Okay, let's have a quick listen to your back. Okay, deep breath through your mouth. In and out. And one more. Good. Okay, pull that down. Let me just take your temperature. Yep, so you got a high temperature. Your throat looks terrible.
Thank you.
That's the good part.
That's a good part. Okay, what's the bad
Okay, the bad part is we can do something for you. Okay, this always starts as a virus, but sometimes when you start getting all these bits at the back, then we think you may have the bacteria on top. I'm going to give you an antibiotic for that because I think it will help. Yeah. I want you to keep going with lots of fluids. You must drink a lot because you're losing fluid. Yeah, you're losing fluid because you're so hot. Okay, you're sweating and things like that. You can buy all sorts of things over the counter, Difflam, things like that, which is quite good to gargle with because it will help with some of the soreness at the back of the throat. Or you could just take plain paracetamol or something along those lines. Yeah.
I'm all the time taking paracetamol stuff.
I think you may because it will bring down your fever a bit. It helps for a while and then it comes back again. You're not allergic to anything?
No.
No. I want you to take 2 of these tablets 4 times a day, okay, and that will last you for about a week, yeah? And we'll see how you get on.
Can I buy them in the pharmacy over here?
Was it a good holiday, or did it rain all the time?
No, it was quite good. The last 2 days was nice, but as you can see on my face, because I went to sleep on the beach. So
Oh, did you? Very good.
That's why my legs also are so red, you know?
Yeah, another reason why you're hot, mate.
Probably. Thank you very
Try
much,
those.
sir.
Okay.
Okay, have a good day then, yeah?
See you later, bye-bye.
Cheers.
He's a little devil. My cat.
Your cat?
The cat bit me and it came up really high last night. And he catches a lot of rats. It was all puffy though. But he's got full of scars with him.
So have you had a tetanus injection lately?
It's been a long time, I think.
Yeah, it is definitely. 2004?
Oh, it was. I think that's when my other cat, I was playing with him, scratched me in the eye.
2004, it's when you had a tetanus, yeah. So we can do that today and some antibiotics today. Yeah? So just give me a second. Yeah, just wait for me there. I've got Dr. Aaron here to have a look.
Oh, yeah. That's where they always get you.
Yeah.
How old's the cat?
He's 10.
Yeah, and then the teeth carry quite a lot of bugs when they get older. So we need to cover it with what we call a broad-spectrum antibiotic, which is augmentin. Are you allergic to any antibiotics?
No.
Okay, so let's do it now and I can sign it. If the swelling gets worse, if you get any tracking up your arm, we need to know.
Okay. Devil in here.
All right.
Yeah, and
Take care.
And I'll grab the vaccine.
Okay, thank you.
All right.
Yeah.
Bye.
Devil.
You take care. Okay, you're welcome.
All right, take care.
Bye-bye, Adriana. Nice to see you.
Bye.
See you then.
Fingers crossed.
Yes, very much so.
Good morning, Hallfield Health Centre. Can I help?
It's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
What are you worried it might be?
Skin cancer.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot.
I fell onto my head.
Right.
I was paralysed neck down. My ankle went up. I heard it crunch and pop and...
We need you in the NHS for a long time, so we need to look after you.
Health Centre, can I help you?
Georgia.
Oh, we're seeing this doctor.
Hi.
Hello.
Come on in. Have a seat. So what's been going on?
She's been getting a lot of nosebleeds, but coming from just this side of the nose, but she's getting a lot of them in school.
Oh, right.
The first aider said to me today it's going on bleeding for at least 5 to 10 minutes.
OK. How often are they coming then?
She could at least have 3 or 4 a week.
Right. And how long's that been for?
Like the last 2-3 months.
OK.
One week when we was in school, she had quite a big one, they couldn't stop it.
Right.
And she said to me, well, if I was you, get her checked, because she could have a blood vessel or something like that.
Yeah, well, it's definitely a burst blood vessel, because that's what's causing all of the bleeding. Should we have a little look and see what's going on? But there's nothing, you're not feeling unwell with it or anything like that? No.
Hello.
Hi.
Have a seat.
Thanks.
Right, what can I do for Hugo?
His eyes, I've been a few times.
Right.
And I've been to see the health visitor as well.
Yeah.
And I'm getting a lot of conflicting messages.
Right.
Every time I come here, the GP's told me that it's kind of normal for his eyes to be this sticky.
Yeah.
The health visitor told me it's not, it's definitely an infection.
Right.
And it's just when he's waking up from nap.
Yeah.
And in the morning, he can't open his eyes.
So have we tried any antibiotic drops?
No.
No, I think that's what we need to do.
Yeah,
So the thing I think that we're probably not passing on to you is that he's got conjunctivitis. It's obvious, isn't it? And it's a bacterial conjunctivitis.
Because this, I cleaned it before we left the house about 10 minutes ago.
I think the thing is, often it clears up on its own over a few days with just wiping it. But if it hasn't, you need antibiotics. How long has it been there for?
5 months, probably.
And we haven't used antibiotics?
Once when he was about 2 weeks old.
Right, OK. So let's try them again.
Yeah,
OK, if it doesn't settle, then come back and see us, OK?
I've just been feeling so frustrated every time I come. I'm just like, my baby's got sore eyes, and it's just like, I'm having to open his eyes up for him every time he has a nap.
Oh, bless him. Yep, so 4 times a day. OK, be careful to wash your hands and everything because it is quite infectious. Give it a week, 10 days. If it's not clearing up, come back.
Yeah,
OK?
Oh, thank you. You go sort your eyes out. You'll be able to see again.
OK.
Thank you so much.
No problem. Pizzaurus Rec, eh? That's fantastic. OK.
Thanks.
Bye-bye, sweetheart. He's gorgeous.
Just look up for me. Oh, yeah. Is it itchy?
No.
And this one's okay?
Yeah, that one's fine.
Yeah. And this is the only place that you're bleeding. You don't get any bleeding anywhere else?
No, nothing. Just
No other bruises to see or anything else?
No.
Because it's really common to get nosebleeds. And what I can see up your nose is that there's a little area which is the place that you get nosebleeds from that's got a little bit of a crust over it, and that's where your nose is bleeding from. And mostly, if we give you some cream, that will settle it down, because often what happens is you get a bit of an infection there, and it stops the nose blood vessel from healing up very well, and that's why it keeps bleeding, all right? And it's not a serious medical problem, it's just that you've got nosebleeds. And as long as you're not feeling really dreadful and unwell, then that's all that we need to do. The most important message is to learn how to stop them, because there should never be a kind of nosebleed that you want to, you don't want that to carry on for you.
She panics, and of course she was panicking and made me panic.
And that's part of the problem often.
Yeah.
So you need to learn how to stop them on your own, OK? And the way to stop them is to get your finger and thumb like this. You put your nose right in the middle and grip really tight. Now, often people say grip here. Means no difference, because that's just bone up there and hard cartilage, so you can't do anything there. And sometimes people say, put your head back. Don't do that either, because then the blood all just runs down the back. You need to hold it like this, but really grip tight. And then you need to hold it for 10 full minutes. And then 99% of the time, that will have stopped all the bleeding. And obviously, if it carries on after that, then try it again. But if it doesn't stop after that, then you need to go and see somebody, because then it's really not stopping. But the major problem is that you don't press for long enough.
Press for long enough.
All right? And then if this isn't working, then we'll see you again, just to follow it up. All right? Cheers, then.
Lovely, thank you.
Bye.
Bye.
Firstly, how are you?
Terrible for the last couple of days, to be honest.
Right, what's been happening?
Feel tight around the chest all the time. Slightest exertion, I'm breathless. But I keep going and it sort of diminishes a bit and I can get over it. And then sleeping, lie down, I feel as though I'm suffocating. I sort of get a panic attack, start breathing again, and I found it better last couple of nights, basically sitting up, trying to sleep.
Right. Over what period of time do you think this has happened?
This last bit now is about 3 or 4 days, isn't it?
Yeah, it's over the really hot weather, and his feet are very swollen.
Yeah, they've never been like that before.
No, so this has happened over the last 3-4 days.
Yeah.
Your ankles have swollen up, but more importantly, you're getting more short of breath when you do something.
Yeah, it might be coincidence. It seems since I've been taking the beta blockers that it sort of pronounced it more, if you like.
But you're getting chest tightness, are you?
Feels like I've been sort of squashed a bit.
And that's for how long?
Only seconds.
And how do you think Alan's been?
Constantly sleeping. If he sits on a flat surface, he's asleep. And he does this regularly.
Okay.
And I can be talking to him like I am you. We're having a conversation, he just closes his eyes. And then wakes up 3 or 4 minutes later, has no recollection of the conversation we've had, which was symptomatic of last time before he had his heart operation. Actually, he used to do that quite regularly.
Still really painful, actually. So it's all up this bone here.
Now I feel pain everywhere. and
Lower down.
In my leg.
Okay.
I've sort of landed with a straight leg and it's bent sort of the wrong way.
Arms up.
There.
It's really limited, isn't
yeah,
it?
It is.
Hi. What's been going on?
I fell down a rabbit hole.
Oh dear, right.
My ankle went up. I heard it crunch and pop and...
Right.
So I've just been getting on with it, but it's not getting better, and it, you know, I can't bend it. You know, like when you sit on your foot,
Yeah.
I can't do any of that.
Okay.
So I think there is some.
And were you able to walk on it at the time?
Oh well, it was a struggle getting home.
Yeah.
But yeah, I've just sort of like pushed
Just kind of
through
got
it.
on through. And what have you been using for it?
Nothing.
This was which day?
Right, 7 weeks ago.
7 weeks ago.
Yeah.
So what's brought you up tonight then?
Well, it's just not getting better.
Yeah.
I am going on holiday on Tuesday.
Okay.
So I just wanted to check before I went.
Yeah, because I think, you know, if you did sprain your ankle,
Yeah.
which is what probably has happened, then
Okay.
it does often take months to get better.
Yeah.
Is it sore at all?
Yeah, it's more here.
Not round the back, though.
No.
Move it round and round.
It's there.
This is where it's sore. Yeah.
Yeah.
That's where it's painful. Because that's the classic spot where you get a sprained
Yeah.
ankle.
Ah, I
Is
can't
it
do
sore
that.
on your foot itself?
No, it's there. I'm going to bend it.
What about
out.
in here?
Yeah. I'm trying not to cry.
But it's more in here rather than in there.
Yeah.
It's more in the over the foot.
It's all of it.
I mean, I think most likely this is just a nasty sprain that you've got. It can put people on crutches, so just because it's a sprain doesn't mean it's not serious.
Yeah.
And it does mean that it can go on for months. It can be worse than a break because actually the ligaments heal up less quickly. Because it's actually more over the foot, though, I think it is reasonable to get an X-ray.
Yeah.
I will arrange that for you to go up and just go and have that.
Drop in.
Yeah. Do you want some painkillers?
I've got painkillers.
You've got some.
Yeah. Is that just any day?
Yeah, 9 till 5, Monday to
9
Friday,
to
so you can
5.
go up tomorrow.
Lovely.
And then why don't you give it a week and then ring just to get the result?
Yes.
All right.
Thank you so much.
Cheers then. Hopefully it will just, there won't be anything there, but if there is, then we'll do something more about it.
Thank you very much.
Okay, bye.
Bye.
Do you ever feel as if your heart's jumping beats?
Not really, no.
No. OK, fine. So it'd be good to have a listen to your chest and heart as well, if that's OK.
Yeah.
So we just pop onto the couch here. Nice breast with the open mouth. And out. Let's help you pop that on.
Oh.
Get proper service here, you see, when you come in. There we go. I think what we need to focus on is just this heart rhythm. If you don't mind, it would be good to have another ECG or heart recording now.
Yeah.
And I'm probably just going to have a word with the cardiologist because I'm wondering if we can just sort you out a bit sooner. And also another blood test. Is that all right?
Yeah.
So we're going to take a seat in the waiting room and they'll call you through into the treatment room. All
Yeah,
right,
for,
but we'll
for
sort you out.
for months and years, don't come here, and then suddenly...
Every 5 minutes. That can happen. That's
Yeah.
all right, we'll get through.
OK.
Come on through. Thank you. Once you've had the recording, if you still take a seat back,
Yeah.
and I'll talk to you at the end, OK?
OK, yeah.
Lee Haskins, please. Have a seat.
Thank you.
Right, what can I do for you?
What it was, I got whiplash down my neck on Saturday.
Yep.
But it's done something to my arm and it's like on numb.
Right.
And I can't lift it to a certain level and it feels really weak. There's nothing there.
What actually happened?
I'm a boxer.
Right.
And I got caught with a shot. I can't remember if it was on maybe my face or something, but it's like whiplash my neck.
Different people have different terms for things, OK?
Yeah, of course.
So what do you understand by whiplash?
I just like put my neck, burn the sensation down my neck.
Right, OK.
I kind of can't twist it.
Can't twist it, OK. Well, how did you feel immediately afterwards?
I felt fine in myself,
Yeah.
just the burning sensation down my neck. I didn't even
Yeah.
know there was something wrong with my arm until I got up and then I tried to kind of throw something back and then it was numb.
Have you taken any painkillers for it?
No, took nothing, no.
No. Any particular reason?
Just thought I wanted
Just
to.
your hard.
Yeah.
OK, fine. And have you had any injuries on your neck? Bad injuries before?
No, nothing before, no.
No, OK. And I can see bruising around there. Is that from
Yeah,
the
it's from the
boxing?
fight, yeah.
OK. Was it a good fight? Did you win?
I lost, but it was good. It was a very close fight, but this happened early in the fight, so if it didn't happen, I would have probably won the
Absolutely.
fight. Yeah, so
right, OK.
we're looking at a
Let's
rematch.
have a little look. Right, if you slip your
Okay,
hat off, what I'm going to do is just see your neck movements, if that's all right. So move your head right back. Yeah.
Yep.
Chin onto your chest.
I feel that.
So you feel like, as in pain?
Yeah, a little bit of pain right there.
I've got a 65-year-old chap who's come in with, basically symptomatic with
chest tightness for the last 3-4 days, which radiates to his jaw and neck area. He's feeling more tired, a bit more breathless when he does anything and when lying flat. And his ECG today, it's clearly keeps varying. It's 154 at the moment. Yeah, he's here in the GP surgery over at Hallfield, so I'll get an ambulance to transfer him over. Yeah, lovely. Thanks very much. Cheers. Bye-bye.
How have things been since we spoke on the phone?
Finally, my headache receded on Saturday.
Good.
But even just moving my head, everything felt totally bruised inside. And this swelling that I've been getting for years now is beyond a joke.
Yeah.
When I got up first thing in that morning, my head was like a football. Well, normally it swells from here. My whole face, I was so shocked when I looked in the mirror, it wasn't like me at all.
Tell me what things you think have been ruled out with it.
They ruled out, well, they were concerned about meningitis and possibly a hemorrhage, in the head.
But I think the headache has resolved now, so really it's the swelling issue that's the problem that you want to...
I've never had a headache like that in my life, ever. And I feel very, very unwell. I'm at the
At
end
a
of
loss.
my...
So I confess that I don't know what it's caused by, and we have discussed it a number of times before. And I know that you've discussed it with specialists as well, and in particular the specialists that know you best, which is the rheumatologist, because of both of your rheumatological problems. And so I don't know what would be next, to be honest, and I am aware that sometimes when that's the story, very occasionally I've missed something, and so have all the other doctors, and there is something that can be sorted out, but quite often we just don't know, and we never will know, and...
It's making my life absolutely miserable.
Yes.
On top of fibromyalgia and arthritis and everything, every other condition.
Yeah. Then there's kind of just trying to manage the problem,
But that's
isn't it?
I've been trying to do that for years. I mean, that's why I've come to a point now where I've tried everything I can think of, but I'm nowhere further along the line, except I'm actually worse with it.
Yeah. So the other thing that we have done is you take a water tablet.
Yes, every other day. Yeah.
Do you think on those days you're any better?
I actually think if I had them daily, I probably wouldn't have the problem of constantly going the entire wipe that day out. I think that my body would balance better.
Well, I would be happy for you to try that out as a sort of trial of treatment, really.
Yeah, that's fine.
And
I don't want to stay on it if it doesn't work.
Because my feeling is that apart from moving your drugs around a bit to try and improve the problem, what I would like to be able to do is to try and make things easier for you.
Yes.
And that is, I think, our best option. How does that sound?
Yeah, that sounds sensible. There's one thing I wanted to ask you today.
Yeah.
I've been thinking about this for the last couple of years.
Yeah.
You know, I'm willing to take my medications and do whatever I can to make my life better.
Yeah.
However, I do not want to be resuscitated if anything should happen.
Right.
So could that be put on my notes?
Yes. So...
I've spoken to my children about it.
OK. So that's an interesting question. So normally we would have that kind of discussion if somebody had a life-threatening condition or they were very frail, which you don't really have either of those things. So you are neither very frail nor have a life-threatening condition.
I certainly don't look frail, but...
no, I think, you really don't look frail. We have a form that we fill in for that kind of thing. Where we write down that we've discussed it with you, that you have agreed that's what you want. And then, so what we do is we then use that form and send that off to the ambulance service so that they know not to resuscitate you, otherwise somebody will call and you will be resuscitated.
That's right.
And that form needs to be with you, so it stays in your home.
But it's about quality of life for me.
Yes.
And my life is not a quality life.
No.
It's like being in a prison.
Yeah, well, it's very difficult. The request for DNR, do not resuscitate, was unexpected. There are protocols that we go through to make sure that we're making the right decision, that the patient is able to make the decision, and if not,
we would convene a best interest meeting. I think that Julie Dawn's able to make that decision herself. But in this particular case, I decided I would have a think about it myself and also talk to some colleagues.
Just going back to the water tablet
Yes,
thing, you only
yeah.
get 28 tablets at a time.
Yes, that's
Shall I
right.
change that so that you can be on them daily?
Yes.
Yeah?
Yeah.
And put that on repeat. All right, well, let's hope that you're right about the water tablets.
Yeah, I hope so. It would
Yeah.
be lovely to have a simple answer,
Yeah.
wouldn't it?
OK.
Yeah, can but try.
Yes.
All right, thanks very
Okay.
much. Yeah, that'd be
Okay,
fine.
fine.
Thanks ever so much.
That's
Thank
all
you.
right. Bye now.
Bye-bye.
Hello. I've got an appointment at 10:20. I can't remember who it's with.
So it's Dr. McLaren.
That's it. I can't remember the name.
Not a problem. We can always find it. OK, take a seat then.
I got my own, thanks.
How many times do we say that? Habit.
Right, okay. Arms now. If you hold my hands,
Yep.
squeeze them really tight. Really tight, as tight as you can. Hurt me.
Sure.
Yep, absolutely. I'm hard. That's it. Pull me towards you. Pull me really hard. Good. Push me away.
Yeah, that's where I don't feel
That's not working, is it?
No.
No. Right, okay. Just relax. I'm just going to check your reflexes, okay? Right, okay. I'm just going to touch you with my finger, like that, okay? If we roll these back up, if that's all right. So you shut your eyes and say yes each time you feel me touch you.
Yeah. Yep. Yep. Yes. Yep.
So you can't feel there, can you?
Yeah, no, that's a bit...
So that feels different.
Yeah, this feels a lot different.
So can you show me where it feels different?
Just like down this line.
Yeah. Right. So I think you've done something that's caused a problem with the nerve going into that shoulder, down that arm, and causing the power problem. It's probably in your neck.
Yeah.
I'm a little bit concerned about that.
Is this a fairly recent tattoo? It's on the blue ink, isn't it? That it's lumpy-bumpy. If you feel there, it's not.
I think part of it is infected. It's passing sort of here and here.
Oh, nice, nice matching pair. If I get a proper tattoo, I want a big one.
OK, fine. You can pop your T-shirt back on. So I'll refer you for an urgent MRI, OK?
OK.
If things get worse,
Yep.
please come and see us sooner. So if the power reduces even further, the numbness spreads,
OK.
the range of movement of your neck, shoulder gets worse, come sooner.
OK, brilliant.
Is that all right?
Yes, no
But you
problem.
can take painkillers.
Is there eventually at any point I can get like a letter to send to my manager?
Saying what?
Well, because we wanted to send it to the board that I had problems with my arm, so we maybe
Right.
get a rematch and stuff
Right,
like that.
OK. You'd have to request a letter and there would be a charge for it.
Yeah, that'd be fine, yeah.
So you could do that via reception,
Yeah,
OK?
reception, yeah. Okay. No problem, thank you.
No
Cheers,
problem.
Doc. Appreciate it.
OK, bye-bye.
Do I just get a letter? Do I? For the...
You'll get something in the post,
Yeah, okay, thank you.
All right,
Yep.
bye-bye.
Come on in, come and take a seat. Right, I'm Dr. Ahmed. How can I help today?
For about 3 or 4 weeks now, I've just been getting a flare-up of eczema.
Right.
And it's just not going away.
OK. And have you had eczema since you were a child?
Yeah, and it just flares up when I'm stressed and overtired.
Any reason why you're stressed at the moment?
Yeah, there's a few reasons, but they're things I'm dealing with, so work and stuff.
What work do you do?
I'm a ICU staff nurse.
Ah, OK.
Yeah.
How are they treating you up there?
Oh yeah, it's fine. It's just the
Work
type
pressures.
of work. Yeah, you get some sad cases in and affects you more than you realise until you get home.
So do you have sort of strategies in place to switch off from when you come back from work?
I live with 10 people, so I switch off pretty easily when I get home.
There's plenty of people to talk
there's
to and things like that. I think that's the main thing, is to talk about it, because you're involved with those cases, aren't you? Do you know about Bristol Wellbeing Therapy? It's just an independent...
I've seen it on our intranet thing.
Yeah, just if you want an independent source of counselling, if you wanted it, there's some information there, and you can do the form online.
Thank you.
And sometimes they just do random workshops that you might be able to attend, and it's just an outlet, really, for the kind of work that you do. You don't smoke, your alcohol sort of intake's fine. Yeah. Let's have a look at it.
So it's
just
always
that.
patchy.
Yeah.
So it's there and there. And then
Your face is all right, isn't it?
It's
Backs of
normally
the knees? Or?
No, I was hoping to give blood next week, but I don't think they're going to let me now, so...
Okay. So I'm going to just do a prescription of Hydromol. And at the moment, with the way the eczema is just on the arms, you don't need a strong potent steroid, maybe just middle of the range.
Yeah.
And I'm wondering if on the same prescription, because I know it's difficult for you to get in, if I just put some 1% hydrocortisone, which is milder, then you can step down.
Yep.
Anything else I can help with?
No, that's great, thank you.
No, fine. OK, so the eczema we'll get on top of, but longer term, we need you in the NHS for a long, 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 long time.
Yeah.
So I need to look after you. OK.
Thank you very much.
That's all right.
great.
Nice to see you, Bethany.
Have a nice day.
Thanks. Take care. Bye.
Young Zhao? Yeah. This way, James. Come on.
Hello. That's a very cool hairstyle. Look at that. That's brilliant.
Right.
Right, I'm Lizzie. I'm one of the urgent care clinicians.
Yeah.
How can I help you?
Yeah, the right hand nasal hasn't been feeling well for a couple of months so far.
Couple of months?
Yeah, at the beginning I had a cold, but the cold is after the cold's gone.
Do you want to have a seat?
Yeah, I just it feels like, you know, every time you have a sneeze. But recently when I lower my head or just knee down, pick up something from the ground, it's a bit sore.
Painful when you lean
painful.
forward.
Just
Have you ever had any problems with polyps at all, with any growths inside your nose?
I constantly had blocked nose when I was a little, and then they gave me treatment by putting some patches along my ears, but.
So since a couple of months ago when you had a cold, what is it? Just this sensation that's just never gone away?
No, it's not gone. It's getting a bit worse. It takes longer to get that feeling gone.
Let's have a feel of your sinuses. Do you have any pain when I press around here at all?
No. No.
Any pain here or here at all?
No.
No. And what about over your eyebrows?
No.
No. Okay. Right, let's just have a look up your nose. You're full of energy, aren't you?
Yeah, always. Always.
Just pop your head back for me. That might be a bit big. Right, if you just slide down on the chair and put your head back there, let's have a look up your nostril. Right, I can't see anything obvious in there.
That's good.
I can't see any large polyps, like large growths or anything like that. I think we could try a nasal spray.
That was I'm coming for probably.
That was what you were thinking, to try something like that?
Try something like that, just to see whether it
works. If we give that a go and see if that helps.
Yeah.
If it doesn't make any difference at all, don't go in there.
No.
Just come back around this way.
You see more stickers on that. Yeah. So,
So one spray in each nostril twice a day.
Okay.
Try that every day. If the sensation gets any worse or you get any other symptoms, come back sooner.
Lovely, thanks very much.
All right.
Thank you very much for your help. Thank you. Thank you, doctor. Thank you. Yeah. Let's go. Bye.
Paul Michelle, please. Paul Michelle. Oh, there you are. Hello. Hi, you come along? Okay. says lumps on head on the screen, is that right?
Yes.
OK, tell me about the lumps on your head.
Well, I think I probably have mentioned them in the past.
OK.
But it just seems to me they're getting bigger. And
OK.
three independent witnesses have told me they're getting bigger.
OK.
I can't tell.
Yeah.
And they're a bit flaky.
Yeah.
They frighten the grandchildren.
Oh, right, OK.
And I suppose I'd like you to wave a magic wand and make them go away, but failing that, some reassurance, I think.
Yeah. What are you worried it might be?
Well, skin cancer.
OK, let's have a look at that. So do you think this is enlarged?
Well, I'm not the best person to ask because I can't see. But, you know, for example, my dentist that I've been going to for years, you can get back, flat in the dentist chair, and he said, they're getting bigger, you know. And then my barber said, they're getting bigger, you know.
Yeah. But this one isn't in the way of the hair, is it? He says unkindly.
Sorry, this was what?
I said this one's not in the way of any hair.
Well, no, I mean, that's increasingly the case.
I can't speak, can I? This one here, I feel confident is something called a seborrheic wart.
That's caused by a virus, is that?
No, I don't know what causes it, to be honest.
Oh,
It's not caused by a virus. It's the one thing that isn't caused by a virus. I'm not sure what you would call that. It doesn't have any malignant features. OK.
Right.
So these two dramatic things that scare the grandchildren.
Yeah.
OK. I think they're both benign.
Yeah.
I'm 99% sure they're both benign. I think probably we shouldn't be doing anything with them, but let's get some pictures taken of them and just get their reassurance on that. Is that all right?
Well, as I say, I think reassurance would be
And if the dermatologist
something.
is unhappy with them, we'll get someone to take a biopsy or to even to remove them.
Yeah, OK.
Yeah? The pictures then gets sent off to the dermatologist. The dermatologist usually responds very quickly once it's been. So you might wait a bit for the appointment to have the pictures done, but normally within, 3 days, we've got a reply back saying this is what you need to do about it.
Yeah. Well, OK, that's fine.
Is that all right?
Yeah.
So you could wear a hat, I suppose, not to scare the grandchildren.
Well, I do wear a hat on a sunny day like this. Does you think that makes any difference? I mean, is it I don't think it make any difference to those, but it's good advice generally, isn't it, when you haven't got much hair up top. So if you go and book that with Kay in the treatment room, let's give it a week after you've had the pictures taken and then phone me and discuss what they've said about it. OK, yeah, that's fine.
OK?
Yes, thank you.
Super. Cheers then. Bye-bye.
Hi, how are you doing?
Yeah, I'm all right.
Good.
So it was just because I'm thinking might try for another baby some point in a few months later in the year, and wanting to come off the sertraline and just kind of make a plan for that. So.
Yeah, OK. How's everything been going from that side of things?
Yeah, good. I mean, I think I'm just a bit of an anxious person, but yeah.
Well, that's all right. But actually things have been quite calm and settled in the last little while?
Well, we both changed job and moved house.
Right, so with
in January and
all
February,
things considered,
but
because that's a stressful time, isn't it, if you do all of that
Yeah,
stuff?
but we've just had a holiday. And,
Yeah. I mean, you're looking very well for it, you know. So
thank you.
And you're thinking about another baby, so that's exciting.
Yeah, not immediately.
Have you done any reading about sertraline and the risks of being pregnant with it? Or?
No, I just presumed I would come off it.
Yeah, I mean, generally that's the right thing to do. There are some risks of, rare risks of the baby not forming properly if you conceive on sertraline, although that's a rare thing. And of course, if people are so ill that with the mental illnesses, anxiety or depression, that they need the pills, then the risk would be greater to stop them rather than to conceive on and off them. So it's a bit of a balance, is I suppose what I'm saying. And I think for you, if everything's going really well, then this is an ideal opportunity for us to think about cutting it down, because actually, anyway, if you're going to have a baby or not, we should be cutting it if you don't need it, isn't it? So, do you think that you're going to be all right on cutting down? Do you have any worries about that?
No, I think a bit of a wait and see.
Yeah.
The only thing is I've missed a couple of days here and there, and I felt a bit off, queasy, like more physically.
Okay,
yeah, but then I figure we'll do it slowly.
Sure, and I think that would be the main thing to say about coming off it, is that people do really notice when they come off them. And that's fine. It's common and normal to get some side effects as you reduce, but it just means that we need to do it really slowly.
Yes.
And so sort of over 4 weeks as a minimum, and sometimes even stretch it out even longer. And what you can do is either just miss out a dose and then take one the next day, or you can just take half a tablet as a way of reducing. Does that sound okay?
Yeah, that's
Do you need any more today?
I've got
to get you through
one
that?
box, I think.
Okay.
So.
Because that 1 box is a month, and so
Yeah.
actually that will give you plenty of
Yeah.
tablets then to be able to do that.
Yeah.
Does that sound like a reasonable
Yeah,
step for
that's
that?
absolutely fine.
I probably don't need to see you again unless there's any problems.
No, I'll make an appointment if I need to.
Great.
Yeah,
I think that's the thing.
fine.
Or if it gets really bad, just give me a ring.
Yeah.
Or just go back to the dose that you were feeling fine on, because actually then you can just cut it down even more
Yeah.
slowly.
Okay.
All right?
Thank
Good
you.
luck. Fingers crossed. And
Thanks.
I look forward to seeing you
All
as and when.
right, take care,
Bye then. Nice to see you.
Come on in, have a seat. I'm Dr. Graham.
I've got an existing injury. I had a spinal injury in 2008. And I have a weak arm.
Yeah.
But today, all day, I've had really bad pins and needles, and I felt really tight and uncomfortable, and it's just making me feel really anxious with it, which is probably not helping.
Yeah. What was the injury that you had?
C5-6.
Right.
So I've had an operation. I've had nuts and bolts in
Yeah.
there. So now and again, I will wake up with pins and needles, and when I'm working it too hard, I get pins and needles.
Right.
But it's been constant today, and it's been really nagging.
Yeah.
And it just doesn't feel right.
Yeah. And what do you think might be going on?
Part of me thinks maybe a trapped nerve or something. I've been feeling it in my leg a bit.
Right.
I'm not in screaming agony.
Yeah.
It's all numbness. I was struggling to hold a pen. You know, I could hold it, but not for long.
Yeah. And when you had the surgery before, had you had an accident that caused that, or was it?
I fell onto my head.
Right.
So I crushed the nerve, and it crushed between the discs. So the discs have come out. I was paralysed neck down.
How are you, Mrs. Smith?
OK, thanks. Not too bad.
Good. It's nice to see you smiling.
Can I take my coat off, you don't mind?
Yes, no, that's not a problem. Do you want to pop it behind the chair? Is that OK? Or you can hang it up on the other...
John.
You're not wearing your designer coat then today? Don't care about that one. OK. You gave me a book last time.
Yes.
On meditation and mindfulness. And I'm symbolically giving that back to you.
You were very gentle.
That implies that if you've experienced differently before... Your blood pressure's been quite steady.
And I've got no worries, my darling, thanks to you.
Well, it's a bit up this morning, actually. Blood pressure. Carl Hazard, please. What's on your mind this morning?
Right, I've got a history of osteomyelitis in my right ankle.
Mm-hmm.
A couple of days ago, I had a bit of a temperature and quite a bad headache. And I woke up this morning and I've got real bad pain on the inside of my right leg and sort of from the groin to the knee.
OK, you've got a history of spina bifida and you've got this problem with the right foot.
Yep.
There's a combination of orthopedics and plastic surgery.
Yep.
Spina bifida is a condition that occurs in utero, in other words, when you're pregnant. It's a problem with the development of the spinal cord and its coverings. It can result in problems with muscle weakness as well as fluid around the brain.
This is quite sore down here as well, where I've got the muscle graft.
OK, and I'm going to just pop you behind the curtain here.
Yep.
I just want to have a listen to your chest and have a look at the leg. So, is it all right to call you Carl?
Yeah, of course it is.
She says, having called you Carl all morning. Oh, there we go. All right. Carl has a significant past history of osteomyelitis. This is a very serious condition whereby you can get an infection in the bone. We also have to bear in mind that Carl has metalwork in his leg, and this is a foreign body. If that gets infected, it can be threatening to the limb in the sense that he could lose that limb. OK, and there's pain in the groin, isn't there?
Yeah.
Does it hurt when I touch?
Yes.
OK, can you push up against my hands? Good, and on this side. Good. OK. I'll let you get dressed. Take your time.
OK.
Is it stopping you from doing anything?
Not really stopping me doing anything. It's just when I walk, it's just gets a bit painful.
There's no signs of any infection.
OK.
I think it would be a good idea to run a blood test this morning because we'll get the result fairly quickly. It may be worth just reviewing you back next week.
OK.
And sooner if things haven't settled or if they're getting worse.
Yeah, all right.
Because of your past history, we're just extra cautious.
Yeah.
But often these things turn out to be just a muscular something or another in view of your
Hopefully
general
it will be.
orthopaedic history, you know? Things, but we'll check you over.
OK. Thank you
All
very
right,
much.
that's not a problem. Take care.
OK, all right. Thank you very much.
Bye-bye.
Thank you. Bye-bye.
You got that.
Well, you would, being a City fan.
All right, so I think you might be right that the disc may have come out again to a very much smaller degree, and it's pressing on some nerves.
Right.
OK? So you probably know this, but you know you've got your bones in your neck.
Yeah.
All the way down your spine, and in between you've got glue-like stuff, which is called disc, and your nerves come out. Yeah. And a little bit of that has come out and is pressing on the nerve, and it's sending the wrong messages down, so the kind of numbness messages, but also pain. Normally, it goes back in again on its own. Do you see what I mean? Okay. But this time, it's staying out for a bit longer than you're used to.
Right.
Does that make sense?
Yeah.
The question is what we do next, OK? Yeah. So the first thing is to think about some pain relief. And the second thing is to think about whether we want to just give it a few days and see if it just gets better on its own, OK? And if it doesn't, then we'll probably do another head scan to see what's happening.
Would that be like an MRI?
Yes. But I'm not saying you need that yet. You know, we know...
I'm reassured that it's something connected with what I've already...
I think it's most likely to be exactly the same as what you had before. Obviously not the whole neck down, OK?
Yeah.
No, painkiller-wise...
I'm not in a massive amount of pain.
OK. So the kinds of things that would worry me and make me think we need to see you sooner would be if you were to get any problems with your bowels or your bladder, you know, losing control of either of them, you know, because that is a worry because it's affecting the nerves that control your bowel and bladder, and that is an emergency, really.
OK.
OK?
Thank you for the reassurance.
OK,
Much
good.
appreciated.
That's
Lovely.
all right.
Thank you. I'll go and carry on.
OK, bye now.
Cheers, bye-bye.
Camera. OK, hi. Right, let's just bring up a chair. Do you want to sit in that one, and Mummy can sit in that one?
Because this is for you, not me.
This is for you. This is something to do with his ears, I gather. Is that right? Yeah.
Yes.
Just fill me in.
He had a perforated eardrum.
This is when he saw Lizzie Harris recently.
Yes,
yeah?
yes.
Okay. And how's he been since then?
Good, really good. We just want to make sure, because he's not been swimming for a while, and he normally does that on Tuesday.
The ear was discharging, is that right? Yeah. Has it stopped discharging now? How's his hearing, do you think?
Good. Back to normal, I think.
Is it?
Yeah.
OK. Well, that all sounds good. All right. OK, let's have a look. So it was the right ear that was the bad one, wasn't it? And the left ear, as you said, was normal? Yeah. OK. Can I look in your left ear first? Look at that one, your good one first. Look at that. OK. All right, so that is a normal ear canal, normal ear drum, no holes or anything. We wouldn't expect it. If I press there, does it hurt?
No.
If I press there, does it hurt?
No.
Good. Very sure about that. OK, I'm just going to take slightly longer over this one. No, everything looks intact, actually. The eardrum is marvellous at healing itself in the majority of cases. So it looks normal, OK? There's definitely no hole in that.
Oh, wow.
A nice sort of shiny eardrum and no inflammation or anything. So, yeah, you can go back to swimming.
Yay.
Yeah. And I'm surprised you say that his hearing's completely back to normal, because it often takes a little bit longer than this. But if it is, it is. So that's great. So, yeah, no restrictions, really.
Lovely.
OK. All right. That was quick, wasn't it?
Yeah.
Good. OK.
Thank you.
Cheerio, then.
Thank you.
All right, well done holding the door open for Mum. It's like a trap, isn't it? It's like an assault course. OK, cheerio then. Bye-bye. Bye, Cameron.
Well done.
Bye-bye now.
Bye.
Bye-bye, boys.
Say bye.
Medical practice, Karen speaking.
Are we talking cancer?
Well, sometimes it can be a sign of cancer.
Yeah. Before I was a very calm person, and recently, when I go on my social media, I see something, it just gets to me, I just get angry.
Is that you?
Yeah.
Blimey. I'll never look like that.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, you must miss her.
I do.
There we are. Okie doke.
It's a good job I've got no kids meeting.
Morning, Ebony.
Morning.
I nearly died this morning, Rihanna. I was running, and there was these 3 sheep that I'd managed to get out of the field onto the dirt path. And then I was like, oh, God, fine, just move out of the way, I'll just walk past you. So I ran, and then they charged at me.
Because I thought you were coming after them.
Well, it wasn't, I was just running innocently. I was listening to TLC.
What were you listening to?
Creep.
Come in. Hi, love. Here you come. Hello. Take a seat, ladies. So, hello, how do you? My name's Debbie. I'm a nurse practitioner. What can I do for you?
My leg hurts on my kneecap over here.
Right.
It all started since last evening.
Right.
She can't bend it properly or straighten it up.
OK. And then when she woke up this morning, she came downstairs still?
Yeah, but
Right.
but she can't straighten it up.
No, I can see she's limping, isn't she?
Yeah.
That's quite
Do
an
it
important point, because usually with children, if it's something and nothing, it would have gone by the morning. What did you do yesterday?
I just was playing and I did some work and I don't know how it started.
You point to where it hurts for me. There. OK, now we need to have a look at it, and I'm just going to take your temperature. What year are you in?
Year 2.
That's a big grown-up year, isn't it?
Yeah.
Right, what I want you to do is I want you to take your shoes off and I want you to take your tights off. You're lovely, aren't you? Eh? Take your coat off as well, because it's... Right, come and walk on this floor. Walk over to me. Oh, darling, does it really, really hurt?
It hurts a bit.
Right, can you try and put your foot down? Does that hurt more?
It's just when I'm going to put my legs straight, it starts hurting.
Come in.
Hi, Rashbini.
Hello. Come in.
How are you?
Come in, come
Okay,
in.
thank you.
Come in.
Thank you.
let me help you to the chair.
Okay, thank you.
So
Thank
just to your right, another step.
Thank you.
There we go.
Thank you.
Nice to see you again.
Nice to see you, thank you. I think I've got a fissure or a similar kind of problem.
Right.
Hemorrhoid.
Yeah.
But basically, it's been going on and off the last 2 or 3 years.
Right.
And it's really, really uncomfortable.
Sure.
We've tried the gamut of ointments, quite a
Right.
number of things, and it's not shifting.
Yeah.
So I was wondering if we could try something drastic.
What were you thinking?
Could we try an injection, do you think?
Is there any bleeding?
Well, that's a tricky question. Being visually
Because you
impaired.
can't see it, can you?
Mm.
No. Have you ever seen a specialist about them?
No, I've had a CT scan and stuff done.
Right, OK. What was that for?
I think just because I was experiencing a lot of bowel problems.
At the moment, when you're pooing, then, does it really hurt?
Sometimes it does, but certainly afterwards, there's quite a lasting stinging and itchiness, and it's really awful.
Yeah, no, of course. Now, I know you've been examined recently.
Yeah.
It'd be good if we had another
No, that's
look.
fine. That's absolutely fine.
Is that OK with you?
Yeah, no, absolutely fine.
OK, all right. Let's pop you on the couch. So... Oh, I was going to come get you. I was going to come get you. So... The couch, can you feel it there? That's the foot of the couch.
That's fine. Okay.
Let me just draw this around. Well, while you're there, just let me get some gloves.
Yep.
Oh, wow, you're already on the bed. You're like lightning quick.
Well, no time to waste.
You see, because you've seen so many specialists, you know the exact position,
Oh, well.
your knees up, it's all done, isn't it? You know, some kind of expert patient. So, OK, that's good. On the outside, I can't see any lump. Yeah, there is a little bit of a...
Pustule.
Yeah, well, no, it's just a little bit of bowel.
Yeah.
There's no abscess there or anything like that. Let's get you decent.
That's right. Thank you.
So it does look like it's continuing irritation like before. Have you been getting things over the counter?
I've been tried stuff like, Sudocrem.
I don't think Sudocrem's going to cut it.
Something needs to cut it, I tell you. Thank you.
There we go.
Thank you.
Good lad. OK, so why don't we try a kind of general cream
Right.
for the moment? Also, something that's got a little bit of steroid in it, as well as some local anaesthetic.
OK.
And then if it's not helping, what I would be thinking is something targeting specifically the possibility of a fissure.
Right.
Is that all right? So that's the prescription.
Thank you.
There we
Thank you
go.
very much.
Good. Do you want to ask me anything else?
That's it, I think.
No? Lottery numbers? No?
Well, I'm sure if you knew that, you wouldn't be here, would you?
Are you ready? First, I'll start at your feet. No pain there? No. Does that hurt?
If it's hurting,
Just say, darling, I want you to say. Cause
No, it doesn't.
I'm just going to move your hips. Does that hurt?
No.
This knee is a little bit swollen
Yeah,
here.
it is,
It is
it
a
is.
bit swollen here. Up you get. There's a good girl. Let's put curtains round you and then you can put your tights back on. I know you're not going to like this, Mum, but I would say we are very, very careful with children's joints. So I think she needs to go up to A&E for them to have a look at her.
Oh, right.
Because swelling and pain in a joint when there is no fall, in children, often it's just their body responding to a virus or something like that, but we can't scan, X-ray, examine, but they do that up in A&E.
Yeah.
Is that
thank you.
OK?
Yeah, that
Pop
would
a
be
tights
good, yeah.
on the... You're a mystery, aren't you?
Yeah, I was wondering as well, how could this happen? Because all the time she was in home. I mean, she didn't go outside, even for cycling.
Yeah. Do you like your bike? Do you ride it without stabilisers? Good girl. That's great, isn't it? What colour is it?
Pink.
Right, so all the best, my love. Get to the bottom of it. See you later, ladies. Bye-bye.
Bye.
Hiya.
My blood test love at 5 to 10.
What name, please?
Kelly, K-double-L-Y.
Brought the sunshine out with you.
Certainly did. And you're looking dapper with the
Oh,
sunshine
thank
as well.
you.
Yeah, all blends in together, doesn't it, for both of us, love there? Made your day, love that.
Yeah, absolutely.
Hey, another thing, you're sweet as a nut as well.
Thank you.
Come and take a seat.
because we chatted on the phone, didn't we? You've been having some difficulty with this pessary, haven't you?
Yeah, she has a pessary. There was a bit of blood loss, wasn't there, Mum?
I'm losing blood all the time, really.
Yeah. How long's that been going on for? Was it just when it was changed, or was that happening before it was changed?
It was happening before.
Yeah.
Yeah.
Is it sore?
I feel sore, yeah.
So what I wanted to do was have a look and see if we can work out why you're bleeding, because sometimes pessaries can rub a bit inside and they can cause a bit of discomfort.
Right.
But the other thing is we need to just have a look inside to make sure there's nothing else that might be causing the bleeding that might warrant a referral to hospital. So shall we have a look and see?
Yeah, you can, yeah.
Yeah. Right. So let's just get you up here. OK, you all right there? Let me pull this round. So, I'm going to put a hand on your tummy first. They're cold, though, on my hands, I'm afraid.
Right. Not to worry.
OK, so I just need you to relax these knees, OK? I think I'm going to take this pessary out today.
OK.
So that I can have a look and so that we can give you a bit of a break inside, all right?
Thank you.
Right, let's just have a little look. You all right?
Yeah.
OK. There we go. You OK there?
Yeah.
Yeah, there is quite a lot of blood in there, isn't there? It's difficult to see exactly. Yeah, right then.
You all right, Mum?
Yeah, fine.
Come here, love.
Right, so looking inside, there is quite a bit of red blood, actually. It's not easy to see any obvious place where it's coming from or any obvious cause for it. I think it's most likely that it's that pessary that's caused irritation inside.
Oh, God.
But I can't be certain, and I think the best thing to do will be to ask the gynaecologist up at hospital to see you soon.
Right.
OK? Because sometimes bleeding after the age of the menopause can be due to other things.
Right.
Problems in the womb or problems in the vagina. I can't see anything there, but, you know, it might be deeper inside.
Yeah, OK.
Sometimes it can be a symptom of cancer, so that's why I want the hospital to see you.
OK.
Yeah? And see you soon. Get it over and done with. Yeah?
OK.
Let's get your trousers.
OK.
There we go.
Oh, you're lovely. Thank you very much.
That's all right. So,
thank you.
My job now is to write to the hospital and
Right.
see if they'll see you. Like I say, it'll probably be within a couple of weeks, but I think it gets it over and done with, doesn't it?
Yeah. Are we talking cancer?
Well, sometimes when you have bleeding after the age of the menopause, it can be a sign of cancer.
Yeah.
So I think it's better to be safe than sorry and go be seen up at the hospital.
OK.
Yeah. I'm going to give you some cream as well, though, in the meantime. There we go. OK? All
Thank
right,
you very
Mama.
much. Thank you very much. You've
OK,
been
you
lovely.
take care.
Thank you.
Thanks for coming in. Thank you
Thanks
for bringing
ever so
your mum in.
much.
We'll get the door. There you go.
Right, thank you.
OK.
It's cancer.
Mum, she didn't say it's cancer. She said it could well be the cause of the pessary. It's been left in 3 months over.
Or it could be cancer.
Yeah, so you've just got to...
I know, Linda.
You've just got to wait and see.
I've got these 2 students with me today.
Oh, yeah.
OK, fire away, ladies.
So how can we help you today?
So I'm just going to lift up. And if the student just has a feeler. So if you just...
Jaundice people, I always thought, how can you tell if someone's jaundiced? And
Yeah.
then someone came in, I thought, right, I can,
That's
I can
jaundice,
see.
exactly, Simpsons.
Yeah. If you just flick that like that, just gently. Feels like a guitar string.
If you feel mine, I've got 2 good ones there and there.
Oh, yeah.
Yeah, so that's what you're feeling for, essentially.
Good job. OK, well done.
I really enjoyed it, actually. It was satisfying as the first one, yeah.
Cheers to the 2 of you.
I'll drink to that as well. Cheers.
Hello.
Morning.
Hello, Mrs. Attar. Come in. Right, come and sit down. Hello. Right, Smee, do you want to come and sit down as well? Okay. So do you mind if Smee tells me a little bit about why? Thank you for speaking to our students, by the way.
It's fine, yeah.
Great, thanks.
Okay, so this is Miss Actor. She's come in with a 2 to 3 week history of hot pain, starting in the elbow. She's tried using some ibuprofen gel, some painkillers, that made no difference. With the pain, it's probably more so on the lateral side.
Yeah.
She's got Surgeon syndrome, and she was told that sometimes she gets some rheumatism as a side effect. I was thinking that possibly it could be more so rheumatoid.
So, you mentioned rheumatism because she mentioned Sjögren's syndrome. Any other ideas?
I think it could be a trapped nerve as well.
Could it also be golfer's elbow?
Yeah.
Tennis elbow.
Tennis elbow.
Yeah, right. OK, so now we're on the right lines.
Yeah.
OK, because she's got tenderness.
No,
I don't. So, the other name for tennis elbow is lateral epicondylitis. Yeah. OK. It is so important that students come to GP surgeries on placements to learn. What they see here, the interaction between patients and their doctors, the conversations that we have with families can't be taught in classrooms or from textbooks. So seeing that firsthand, there's no substitute for it, really. So what might she be doing on a daily basis that could cause this?
Helping the daughter.
Yeah.
It's all your fault.
Oh, look at that face.
I work in a school. I help children with disabilities. I help them a lot. And obviously this one, she needs help as well. So,
What's your name, darling?
Khadija.
And what does your mum do for you to help?
She pushed in the wheelchair. She helped a lot.
Does she? So now we think you've got a condition called tennis elbow or lateral epicondylitis. Now we've got the diagnosis, we need to come up with what we can do to help. So she's tried ibuprofen gel, she's tried ibuprofen tablets, and they are certainly options.
Steroid injection?
Right, now we're talking, because that will give you probably the quickest relief, really.
I would prefer something quicker, yeah.
Do you want it now?
I don't mind it. If it helps, because it's got to a point where it's just annoying.
Yeah. Right, let me draw it up.
So what do you think? Marks out of 10?
Yeah, come on, Khadija. How did they do? Not me. I'm 10. Go on. What are we going to give Eleanor first of all?
9.5.
9.5. That's not bad, is it?
That's a good score.
What about Sameet?
Same.
9.5. Oh, I think
you always got to leave a little bit for the challenge.
Yeah, I like that. That was fun.
Right, sharp scratch. And with tennis elbow, you want to try and cover as much of it as possible. And I would just fan a little bit out. Timmy, just press that down for me, so we're all done. How was that?
That's all right.
10 out of 10?
Yeah.
What do we reckon, Khadija? Come on. Throw me a bone. 10 out of 10.
She's always having a bone.
Hello. Are we all right?
You look very tan. I agree.
Do you think?
Yeah.
I'm still Menorca tan. In the summer holidays, they made me do this CCG video about the sun safety with children called Slip, Slop, Slap, about putting on sun cream. And there was me, like, really tanned. I'm so not the right person to do this. Really.
That's so funny.
Hi, I'm Dr. Tatham.
Hello.
Hello. Right.
Oh, this has been going on for so long now.
Right.
And it's just basically, I started last year in May with a problem in the top half of my back, in between my shoulder blades, when I sort of try and like bend over a tiny little bit and breathe in. It's really sharp pain. So I tried everything. I've been for acupuncture, I've paid for physio, I've paid for sports massages, I've paid for a chiropractor, I've tried naproxen, I've tried tramadol. Nothing was even masking it. It's the neck pain. That is something that I've had ongoing for probably about the last 10 years of my life. It's like a really like hot, like intense, sharp pain down my arm. What I get around here is a hot, stabbing, dull, constant, like aching pain.
Right. What's your main worry about all this?
That it's not going to go away. It's yeah. Go
Show
on,
me if you
go
want.
Doctor.
As long as it's accurate. A bit like Brad
Well,
Pitt.
you've got a strange growth coming out the top of your head at the minute, so I can't say that's particularly accurate. It gets me down.
Okay.
It makes me ratty with my kids.
Has this stopped you doing anything in particular?
It stopped me doing like upper body exercises now. I can't do like lateral pull
So you've
downs
changed what you do.
or shoulder raises. I can't do anything.
Yeah.
This is what my back did look like.
Oh, yeah?
3 years ago.
Is that you?
Yeah.
Blimey.
I'll never look like that. I can tell you that for nothing.
I want to have a look at your back?
Yeah.
So I'll just go and get a chaperone, all right?
Yeah, cool.
2 seconds.
Yeah.
Right, then. Right, this is Aidy.
Hiya.
So, you just take that top off of
Yeah.
me and we'll have a good look at stuff. Right, can you just point out to me where you're feeling that pain now?
It's just all there.
In there, right. Right, can you twist round to the right? Oh, it's stiff. And twist round to the left. Right, push that wall over for me. Don't actually, I'll end up in trouble, but pretend. Does that seem to aggravate any of your symptoms? It does?
Yeah.
Right, OK. Follow me, so go out to the side with your arms, and if you get any pain anywhere, just tell me where it is.
You know. All
There.
down there, yeah.
Right. Pop your top on, thank you. OK, so what I think this is it's the muscles between your shoulder blades that aren't quite right. So if you want a proposal from me, it would be that I get you some NHS physio and...
I've done all the muscle building stuff like that before, so I know how to strengthen the muscles in my back.
I know,
so I
but
just
it's
think,
slightly different.
I know, but...
It's slightly
I don't know,
different.
I just feel like... I think I have had physio for this. If you look back on my record, like 10 years ago, there's some... I just feel like I'm just going through the motions with it. I feel like
I understand
Do you know
that.
what I wanted to get today? I wanted you to come and refer me for an MRI scan.
A lot of people do.
Yeah.
And I understand why people want the scan and feel as that's going to give us the answers. But from what you've told me today, I really don't think it's going to further our journey whatsoever. An MRI scan would show us when something is broken or misaligned in the back. In most cases of back pain, that's not the case, and the pain results from the way we use our back or misuse our back. And so an MRI scan wouldn't demonstrate to us anything having gone wrong, and therefore is often very unhelpful.
I would be amazed if hospital physio sorts this out, because it's been, like I say, it's been 5
I will tell you
years
now,
in the
6
making.
sessions of hospital physio isn't going to sort this out, OK? But it's going to take some months of you doing it to really notice the difference.
OK.
I've got a lot of sympathy for patients who come to us with an idea about what treatment that they should have. But as gatekeepers to the NHS, we really do have to keep a handle on what we refer patients for. What I'm going to do is leave you with an open appointment to come back, and then we can talk about what the next step, which may be imaging, but we'll talk about that then.
All right.
Right, OK. Can I keep that for my notice board? No, that's very good of you, thank you. Nice to meet you.
My hair is so short.
Short?
Yeah.
It's long. My hair's short.
But look, like it's just short.
Hi there, I'm Linda Eves. How can I help?
I've been getting really bad migraine headaches all this side, and I can't like lift my head up.
So is it like a throbbing kind of a headache?
Yeah, like I can't drive my car.
Okay.
I can't get up.
Yeah.
Like my eyes are burning. I feel very, very tired, lazy, moody.
It certainly sounds like a migraine.
Yeah.
Have you had migraines before?
No.
Okay.
No.
When did you last have your eyes checked?
It's been a couple of years ago.
All right.
Yeah. I think I need to book a
Yeah,
X-rays
I was going to
as well.
say. Would you say anything seems to make it worse?
It's just like general stress, like, I don't know. Like my family's saying to me that you might have bipolar because I'm moody all the time.
Okay.
Like normally I'm a completely different person.
Let's just check your blood pressure if that's all right. Have you ever felt that you might hurt yourself in any way or not?
No.
We have to ask these questions when people talk about their mood. Your blood pressure's fine, OK? It's just, I'd like you to tell me a little bit more about your mood.
I just like feel really, really moody.
Crying a lot?
Yeah, crying a lot. Being like my own world for some reason. Like, you know, like small thing I make it big issues, like in my head.
Yeah.
Before I was a very calm person, and recently, even I'm on the phone to my friends, I've been just like flipping, shouting at them. I just get too scared as well.
Scared?
I don't know, I don't want to go through depression or bipolar and stuff. I just want to be a normal person.
She's scared now, honest. I'm always scared now. Any pain I get, I'm like, I hope it's not sepsis, I hope it doesn't come back.
You nervous?
No, not too bad.
Yeah? Do they numb me first?
You'll be OK. I'm here to hold your hand and to talk nonsense to you in your ear.
If I hate this.
OK, so just a sharp scratch.
Oh, you OK? You've been really brave, I know you.
Shut
Honestly, I'm not joking. I just don't know why my life has gone this way.
How are you feeling about it?
We're all right. I'm a little bit nervous now, to be honest with you.
Are you? Why?
It's your neck, isn't it?
It'll be all right.
I'm not gonna lie, I'm nervous.
You're nervous. Don't be nervous.
Scared.
Oh, don't be scared.
Have a seat. I'm Dr. Tatham. So...
There's only 2 ones that I really want removed, and he said you're only going to be able to do 1 though. But the other one is literally on my leg, and I've caught it and it started bleeding.
Right.
That's the only reason I wanted that one off.
We'll have a look and we'll see what's what.
Right, OK, so you lay back. Right, OK.
I've been dreading this all day. Oh, we're going to actually ring up this morning and cancel it, but my mum shouted at me this morning.
OK.
Don't worry.
She had a right go at me.
Are you OK?
Yeah.
Right, where am I looking?
It's just sort of like on my right bum cheek kind of thing.
And where's the other one? Yeah.
That's just there. That one catches on my clothes, but it goes up like a little dried up Rice Krispie. So I've started wearing high-waisted pants now so that it doesn't catch on it.
Well, they're fashionable, aren't they? Are they fashionable?
So,
yes, they are.
Very fashionable.
Right, so...
You are going to numb it though, aren't you? I'm not, honestly, I'm not going to feel it.
Yeah. Tap.
That's not your needle.
Oh, we're going to say.
Yeah.
No, you get the small one.
We're not that mean. You OK? Don't worry.
Right, roll over onto your side towards Karen if you don't mind. It's a right awkward place, isn't it? There we are. Okie doke.
You OK there?
Oh!
It will sting. It will sting.
Oh, no, that's hurting. Oh.
OK, so if we take a little look at these questions, OK, how often have you felt down, depressed or hopeless?
All the time, honestly.
Do you ever feel bad about yourself or like you're a failure or you've let your family down?
I feel down about myself,
Yeah. How often have you had any trouble concentrating on things like reading the newspaper or watching television?
Yeah, I don't like watching TV.
OK.
It just gives me depression more. When I see things, even like when I go on my social media, I see something, it just gets to me, I just get angry.
This just sort of gives us a baseline score so that as you get help and treatment, whether that's talking therapies with medication, we'll be able to see hopefully some progress over the next few weeks when we look at the same questions again. The best treatment for people who are experiencing low mood is some talking therapies. How do you feel about that?
Can I not get any medication that like lifts my mood up?
Is that what you were hoping for? Is that what you were expecting?
Yeah, I need something that makes me better. I want to feel normal, like other people feel normal.
We could try you on a low dose of medication, but I just want to emphasise the fact that it is good to have talking therapies alongside that. Let's settle this migraine down first.
Okay,
that should sort that out. And then let's start on a low dose of something called sertraline. Is that OK? And then we'll be in touch in a couple of weeks and see how things are going. All right? We'll try that number or that number for counselling, or you can come in and see this lady. Now, for some people with this medicine, they do feel a little bit worse in the first few days. Hopefully not a lot worse, OK? But it's not a quick fix.
OK, thank you so much. Bye.
Bye-bye.
Bye.
Right. It's a bit sensitive around there. Can I squeeze my hand?
Oh, she's good
Told
at
my
holding
mum she
hands,
should have
it's
come with me.
Oh, no, it's my role. What are you normally doing on a Monday?
But I would have normally been at work.
Right.
Okie doke. So, let's sort this one on your waist, shall we? Perfect. So this will sting.
Well done. Well done.
I don't know how I can moan about this. I've had tattoos. They hurt a lot more.
Right, here you go.
OK? Can you feel anything?
It's just a little, like, tugging.
Oh, you feel tugging, yeah. Nothing sharp.
OK? It's gone.
There you go, not too bad, eh?
OK.
Okie doke.
Right, last one.
Last one.
Well done, well done. Well done. It'll ease in a minute, literally seconds.
There you are. Worst bit.
It's a good job I've got no kids being it because I don't know how to get food.
You do it. Right.
There you go.
Is it done? Yeah. That was the least painful.
That's good. Save the best for last.
That one up my right swell.
Have you?
What did you do this weekend?
Went to Aberystwyth.
Where's that?
It's in Wales.
You went to Wales?
Yeah, I went on Friday, came back Saturday. Megan...
Came back Saturday?
Yeah, I went to a uni open day with our Megs on Saturday.
Uni?
Yeah.
In Wales?
Yeah. She looked at Banger already, and this is the other one.
She looked at what? Banger?
Banger.
Banger? Banger and Aberystwyth. Am I saying it right?
Aberystwyth.
Aberystwyth.
How can I help?
I've got a leg infection, right leg.
Okay.
How long have you had that for? Antibiotics, and it's still not cured.
How have you got this infection then?
I walked into a road sign.
Okay.
Well, not a road sign, a street sign. Everybody else puts them on a wall. Not a great yarmouth in Norfolk. They pull them out about a foot away from towards the edge. Bright sunny day, I moved over to let somebody pass me on this side. Straight into it. Bang.
Have you had any temperatures at all or anything like that?
No.
You don't feel unwell in yourself? No. And do you feel your leg is red or hot or anything like that?
It is still warm.
Yeah.
Check this off. I've got monkey toenail actually now.
And where did you knock yourself in the...
Well, it scabs out, just go in.
Just pop your leg down for me, please. Ow. And is this what your leg normally looks like?
No.
It looks more red to you?
It's more red to me. It is on the night. It really flared up and it burns.
Well, it doesn't feel warm the way you were saying.
Back there. Yeah. That's normal.
Are you not feeling breathless or anything like that? You're not feeling short of breath or anything?
No.
Okay, well, there's a lot of water.
It's fluid, isn't it, on that?
Yeah. So I'm just going to give you some tablets for
What
that.
tablets?
Yeah.
Yeah, my wife's had them. She's feeling good in the toilet. Cheer up, might never happen.
So I'm not going to start you on any antibiotics, okay? You've had 2 weeks.
2 lots, yeah.
It's going to mess up with your bowels. Yeah. It doesn't look too bad to me there, okay? Keep an eye on it. Try to keep your legs elevated. You're not allergic to anything, are you?
On an ex-wife. Best thing I've ever done. We're still friends, and that's as far as it goes.
That's good, isn't it? So you know what you're doing, yeah?
Yeah.
So I want you to keep an eye on the leg, okay? If you think it's getting worse, you need to come back and I'll have another look.
Right,
See you later.
Right, thank you.
Bye.
Open wide, Henna. Stick your tongue out, say ah. You're never really off duty in the medical profession. Staff ask you questions from the girls in reception, admin, and you're always sort of watching out and about.
If there's somebody in the public who might need your assistance, you will do what you can to help them.
It's a 24-hour job.
There was one time that I was waiting for my luggage in an airport and a lady collapsed. She wasn't breathing. There was a defibrillator nearby. After 3 shocks, she did regain consciousness, which was amazing.
So I think the most exciting out of hours incident we've had was the birth of our son, Henry. You delivering Henry.
Daddy was midwife
Out
at
Henry
home.
came.
I was trekking in Nepal, and one of the ladies in front of me tripped and fell and broke her arm. I managed to get a plank of wood and padded it with newspaper, and we used some scarves to wrap around it, and then she was able to walk back to the road to get to the hospital in time.
I'm here.
She wanted Krista.
Give us a shout.
Yeah, if you feel poorly, let us know. There was one time at the gym where a man was talking about a rash in his groin and suddenly just pulled down his pants right there in front of everyone.
Give it another week. If you get worse, see doctor. All right, my darling. Drink plenty.
Hello, hi. What can I do for you?
I found a lump under my arm. I say it's the size of a pea. It doesn't hurt, but it's definitely a sore feeling.
You've not noticed any discharge from there?
No, well, it's not like a spot or anything. I got in the shower, felt the lump. I thought, well, you automatically think about it, you know, cancer, anything like that. So I thought, well, I'll get it checked out by you guys. The only reason I'm really concerned about that is because my dad died of cancer.
Hmm.
So whether it's in your genes or if it's, do you know, hereditary, I'm not sure. But I thought I'd get that checked out.
Okay. And what kind of cancer your dad had?
It basically was riddled with it. It was everywhere.
Come in. Good morning.
Good morning,
take
love.
a seat, love. Is it Beryl?
It is, love.
Back where, love?
All right, my love.
Right, OK. You wanted to book another appointment, did you, my love?
Any time, any day, love.
I think you'd benefit from some steroids today. What do you think?
You are, love.
You're right.
All right, love.
Deep breaths, my love. And out.
Hello.
Hiya, love. You OK?
Yeah.
Yeah.
It's all right, carry on. I feel so sorry for you, love.
It's one of them days, love. Don't worry about it.
All right then, my love.
Thank
you.
you. Bye, Amy.
Come on, Bubba. See you later.
Ta-ra, love.
In you come, my love. I'm Debbie. So this is baby Dylan. He's 9 weeks old.
Yeah.
And your mum.
Yeah, I am, yeah.
And today Dylan's come for his 8-week baby check. Have you got any more children?
Yeah, I've got 4 at home.
4 more at home?
Yeah.
Wow, so he's your 5th.
Yeah, he's my last.
Your 5th and your last, definitely. Well, we'll talk
Kept trying
about
for a
that.
girl, but all boys.
Have you got 5 boys?
Yeah.
Fantastic. And there is some very rare syndrome that touches your family a little bit.
Yeah, I've not seen any in
But
him,
you've not seen it. Has
No,
any of
I've
your
not-
other children got it?
My eldest and the one just before him.
Right,
yeah.
so it's called Waardenburg syndrome. Yeah.
It mostly affects the hearing.
The hearing, yeah, and
but
some
he passed
pigment.
his flying colours,
He's passed his
yeah.
with flying colours. So you know all about that and you're
Yeah.
happy with it. Right, my love, so I want you to take all his clothes off, leave his nappy on.
Hello, chunky monkey.
Hello. Hello, darling. I'm your Auntie Debbie. I'm going to turn my light off now and look inside his eyes.
Sometimes he goes a bit boss-eyed. Is that normal?
Babies, you in the first couple of months often go boss-eyed.
Oh, OK.
He's looked fine today. Keep your eye on it for 3 or 4 weeks. If you see it again, we want him to come back.
OK, then, no problems.
Just going to listen to his heart. What are we doing to you? Oh, yeah. Right, so his heart sounds are completely normal. He's breathing beautifully. Just check his testicles.
Yeah.
One there, look. One there. He's got both of them down already. So if you dress him but leave his legs out, and then I'll get his injections ready while you do it.
Hey, you're so nice.
So until your oldest child had this syndrome, did you know anything about it, or was it?
My mum's got it, yeah. My mum's fully deaf.
All right.
Yes.
She's fine, or does she live free?
We all sign in the family.
Yeah.
Her mum's deaf, her dad's deaf.
Right.
I'm partially deaf in
Oh,
this
you
year, yeah.
Pop him on your knee when he's ready, my love.
Coming in you.
No need to rush, though. So, the first thing he's going to have is drops in his mouth, and the drops protect him against a virus called rotavirus.
Yeah.
They taste nice.
Oh, OK, that's good.
Rotavirus is a very nasty diarrhea and vomiting bug. Now, then, you'll like these because they're like sweeties for babies. A big bruiser like you should love these. There you go, aren't you clever?
He won't turn anything that goes in his mouth down.
That's what we like, though. Big strong babies, there's not like them, is there? So if you put your hands around his middle, I'll deal with his legs. It's going to scream like mad. His
Yeah,
legs are going to bleed.
expecting
You're
it.
ready, aren't you? You're a sensible lady. 1, 2. First one done.
I know, baby. Oh, bless him.
All done, darling. There you go. All done. I'll have that in a minute when it's settled. There you go. Get that done. Babe. What did the nasty woman do to you? There you go.
Oh, darling. Oh, bless him.
Where do you feel the lump?
There. Just put your finger right there. Feel it.
Because I'm rubbing off my finger on it, isn't it?
Yeah. It's only so it only hurts slightly if you push on it.
Yeah. It's a tiny, small lump, isn't it?
Yeah.
Yeah. Okay. I'm just gonna feel your armpit if you don't mind. Okay. Okay. Can I see the other side as well?
Yeah.
Okay, that's fine. And should we? Yeah, you can put on your shirt. About the lump.
Yeah.
So this lump, I know you said you were worried about cancer.
Yeah.
It doesn't look like a type of lump that we would see with cancer. It's something we call folliculitis. What it means is that we do have hair on our body in different regions.
Oh, yeah.
When one of the hair somehow falls and the infection gets entry into the root of the hair, that causes a bit of swelling. That's what it is.
Oh, okay.
So it's nothing but the blockage of the hair root.
Yeah.
We don't need to do anything specific to treat it. It gets better with time.
Yeah.
And most of the time, it resolves within a week or 2 weeks' time.
All right.
Just examine it after a week. It probably would have gone.
All right, brilliant. Cheers.
Thanks a lot.
Thank you.
I'm talking to an 80-year-old this morning. She says, doctors asked me to book a telephone call. I went, right, okay. Tell me which day is best for you. And she goes on, this is what I do this and I do. And I go to the gym on a Tuesday. I went, what?
Oh, my granddad's nearly 90 and goes to the gym 6 days a week.
He says I'm 80. And I've been going every week for the last 25 years. I thought,
Oh,
you
my
girl.
gosh.
Yeah. Got to go and join him myself.
Mr. Robinson.
Yes.
Come in. Right then.
Yeah.
How are you?
Well, not so bad apart from my leg. The trouble is, you put it with the unit there, but I do stumble a bit with it. But it's at night in bed, that's where it's worst.
Yeah.
You know, you get interrupted sleep.
So where exactly do you get this pain then?
Here. It's here mostly, but same as I come this morning, it's going down my leg. Yeah.
Shall we have a look at you?
Yeah.
You take your jacket off.
Yeah.
Do you live on your own?
My wife passed away 2 months since,
Oh, I'm sorry.
after 70 years.
Oh, 70 years, gosh. Oh, you must miss her.
I do.
Yeah. Do you think that keeps you awake a bit at night as well?
Pardon?
Does that keep you awake a bit at night too, or...?
It's getting up to sleep, you start thinking.
Yeah, yeah. Have you got family nearby?
Yes, yeah.
Can I untuck you?
Yeah.
I do think you look incredible for your age.
Yeah.
You're 93 now?
Yeah.
What's your secret?
Yeah, a pint now and again.
Good lad. Right then. Did you get out and do much walking?
Not a lot.
Did you get out the house at all much?
Yeah.
Yeah?
Yeah.
You got friends nearby? Good.
Yeah, yes.
Can you feel that?
Yeah. Just downside here.
More that side, yeah?
Yeah.
Just put your leg back down. So you feel it when I press?
There, yeah.
Yeah.
There.
Yeah, so it's right on the outsides of your thighs here, isn't it?
Yeah.
It does definitely seem more pain in the hip, doesn't
Yeah,
it,
yeah.
that's causing this?
Yeah.
So I think best thing is to try and keep as active as you can. So a little bit of walking will help. Do you think when you're out and about it might help to have a stick? Have you got a stick?
Yeah, I have one.
Yeah, just so you can catch
Yeah,
yourself and just... What we don't want is for you to fall over, do we? Yeah. So there's this issue of the pain at night. Do you think it might help if I give you something that might help you sleep but might help a bit of nerve sort of pain? I'm thinking of a tablet called amitriptyline that might help you sleep. Should we give it a go?
Yes, if I can put my glasses on.
Oh, yeah, forgot about them. Good job you remembered, didn't it?
Thank you.
There we are. OK. So, I'll give you a ring in 2 weeks, OK? Any problems,
Thank you.
just let us know.
Right, thank you.
Give that a go and see how we get on.
Yeah, thank you.
But I think it's probably that hip, you know.
Yeah.
You've probably got a bit of wear and tear in it, haven't you?
Yeah.
So I've 93 years of use, hasn't it, eh?
All wear and tear.
You take care of yourself, all right? Bye-bye.
Thank you very much.
Right, lovely to see you. And thanks for sharing that with us as well.
See you later.
Sorry about it.
Not at all, not at all. Nice to see you again. I hope I
Okay,
don't
then.
see you, obviously, for a long time, but
Yeah,
well,
so do I.
all right then.
Bye-bye. There you are, hold your jumper. Bye-bye. He's lovely.